Welcome to the board meeting of the Board of Vocational Nursing and Psychiatric Technicians. This meeting is being held Friday, November 16th, 2018 at the Department of Consumer Affairs Headquarters, hearing room 102 at 1625 North Market Street, Sacramento, California, 95834. I would like to call this meeting to order. I'd like to thank the board members for a late night yesterday with our closed session items. I would also like to thank the schools and other members of the public who have joined us today. For the sake of time, I will not be introducing those who have signed in, but we appreciate your presence. If I could ask everyone to stand and join us in the pledge as led by my fellow board member and veteran, Paul Sellers.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm Tammy Andozo, board president, LVN member. If I could have the board members please introduce themselves, starting at my far left.
Good morning. I'm Paul Sellers, Psychiatric Technician member.
Good morning. John Deerking, public member.
Paula Amazola, public member.
Good morning. Bernice Basti Martinez, public member, vice president of the board.
Good morning. Kenneth E. Maxey, public member.
Samantha James Perez, psychiatric technician member.
Alita Carpenter, public member.
Good morning. Cheryl Turner, public member.
Thank you. At this time, I would like to have the executive officer introduce herself and staff present.
Good morning. Thank you for coming to Sacramento. Elaine Yamaguchi, executive officer. In the audience, we have a number of our own staff, our AEO, Vicki Lyman, Christine Dano, who's been our acting board analyst, Jay Prouty, who's our discipline manager, and oh, my eyesight. In the back, we have our NECs, Jessica Gomez, Faye Silverman, Beth DeYoung, and Margarita Valdez, our education analyst, Geraldine Marcino, and I think that's everyone. Do I have everyone? Great, thank you.
So,
thank you, Madam Chair. Kenneth Swenson, Senior Staff Counsel, Attorney 3, as Board Counsel.
thank you. The Board of Vocational Nursing and Psychiatric Technicians is required to hold public meetings and make policy decisions that protect the health, safety, and welfare of California consumers. Public meeting agendas are prepared well in advance of board meetings. The agenda requests for consideration must be clearly set forth in writing. The board requests that all items and supporting documents be included in the agenda to be received in Sacramento headquarters by the first day of the month preceding the month of scheduled board meeting. In addition, if there are any documents that you would like board members to timely review and consider relative to an agenda item, the board asks that you submit 15 copies of the document and provide the board an electronic version of documents, preferably on CD. Please ensure that you redact any student names prior to copying information. During the meeting today, public comment is welcome on any agenda item when the item is taken up by the board under the Bagley-Keene Open Meeting Act. The board may not take any action on issues raised by public comment that are not on the agenda, other than to decide whether to schedule that issue for a future meeting. If any person wishes to address the board, please come forward to the podium when I call for public comment. It is helpful for the record if you would state your name and the name of the organization you represent. However, you may remain anonymous if you wish to do so. Always, just a reminder, please conduct yourself in a professional manner while making comments. I must insist that all those who wish to comment direct their comments to the board members and refrain from personal attacks. We have a very full agenda today. In order to allow the board sufficient time to conduct its scheduled business, I may limit the time given to each person who wishes to comment, generally 3 minutes. Please understand this is because I want to hear from everyone and give those who wish to do so a chance to comment. I would rather hear from everyone for 3 minutes instead of one person for 30 minutes. When making comments, please make them focused and relevant to the applicable agenda item and directed to the board. If you wish, it's acceptable for you to simply state that you agree with a previous speaker, or you may make an original statement. If I should forget to ask for public comment on an agenda item, it is not because I intend to limit comment. So please raise your hand or come to the podium and I will recognize you. The board appreciates your cooperation and assistance in meeting this legal mandate. So now let me talk for a moment about the agenda. There are formal breaks periods listed on the agenda. However, due to the large amount of items we have today, the only formal break that we will be taking is lunch. Otherwise, if board members or staff or the audience members need to take a personal break, feel free to do so on your own. We will not be stopping proceedings. I only ask that you are as quiet as possible when leaving the room, as not to disrupt business being conducted by the board. So we're going to get started. And first agenda item is the board meeting minutes. We're going to defer that for February so that the board members have time to receive and review the minutes. So we will move on to the executive officer's report.
Thank you, Madam President. First of all, let me say again, welcome to Sacramento, and I appreciate everyone being able to come under such dire environmental concerns, and of course, we are all thinking very positive thoughts for folks in the fire areas. The first item I wanted to report, of course, my written report was in the packet, but the most important issue to talk about is always, of course, our staffing. I think it's interesting and I think it's noteworthy to mention that this time last year, the board had something in excess of 20% vacancy rate, and right now we're very, very close to full, and I think by January we may very well be at 100% staff, which I think is very exciting. It's creating some logistical challenges for Vicki and the rest of the staff, but finding everybody a good place to sit, making sure everyone's equipped and trained. But it's been a really noticeable, I think, improvement in staff morale, if nothing else, that we do have folks coming on board, learning to do the jobs, and I think a lot has happened quite quickly. We've had a lot of things in the works through summer and spring, which is just now starting to come to fruition. So it's an exciting time. I think that we will take on 2019 fully staffed, and we did a lot this year, and I think 2019 is going to be an even more successful year vis-a-vis our staffing. The second thing, unless of course board members had any questions on the written report, basically I updated on a variety of things, our work with the Substance Abuse Coordinating Council, our work with the Earn and Learn Steering Committee, our work with the National Council of State Boards of Nursing, and of course our new projects going on with DCA's organizational change management, which I think is a terrific and really, really valuable thing. I think, actually, you know what? I think I might comment real briefly on that. As the board members will recall, in our sunset legislation last year, it was mandated that the board have its licensing functions audited as we worked forward in complying with our sunset bill. One thing that we've been, I think, really, really fortunate to enjoy is the support of DCA's executive office and other programs. So one thing that we have been working on since summer has been with the organizational change management office, who has come to work with us a couple days a week. What they're doing is looking at all of our program areas. They've started with licensing evaluation. Excuse me. What they're doing is they're mapping out all the individual business functions, what it takes to do all of the work we do. And they've been meeting individually with staff members, with the teams, with the management, and with myself and Vicki, to really think through the efficiency and the efficacy of what we do. And one of the most exciting things that they do is they take out they take the business processes and they'll map it out in terms of individual functions, and then they'll work with the analyst in charge. And this way they're able to identify things that maybe can be streamlined, maybe can be made more efficient, steps that maybe have become obsolete with technological advances. So we're looking forward to moving through this whole process. OCM will be working with, of course, they're coming close to done mapping with our licensing evaluations. They'll be working with our administrative staff, and they'll be working with our education staff as well. And we anticipate working with them through spring, when we would be able to have, I think, some very solid, no pun intended, recommendations and agenda to move forward with making, I think, some very important changes in the way we do business. I think it'll improve our customer service immeasurably. So, like I said, it's a very exciting opportunity. We're very happy with the way we've done it, and our consultants have been very kind and very responsive, and they've also come back and told us how engaged and how enthusiastic the staff has been. Basically, this is a great new time for us, a really good opportunity, and so much so that although our enforcement division was looked at quite closely by the monitor's review, we're hoping to be able to revisit the OCM models with our enforcement programs after we've given our new enforcement chief about a year or so to I think really get a sense of where she would like to go and things that she is seeing to change and update. Now, aside from, if there were any other questions from the written part or anything that you might want to know about that's going on, it has been a particularly busy quarter since August. But I think one of the most important things that this board does, of course, is as the fiduciaries of the board. And so we've asked Mark Ito from the budget office to come and look through our expenditure projection and our budget report. So.
Good morning, board president, board members, Ms. Yamaguchi, legal counsel. My name is Mark Ito. I'm the budget manager from the Department of Consumer Affairs. I'm excited to be here today to present your budget, answer any questions, alleviate any concerns you have regarding your budget. Before I get into the documents you have in front of you, let me give you a brief overview of the budget process for the department. All DCA programs participate in incremental budgeting, which means the starting point of every year's budget is the prior year's Budget Act, which was approved by the governor. So in layman's terms, we don't start from zero, we start where we left off last year. And from there, we make incremental changes to your budget through budget change proposals, budget letters, executive orders. For example, one of the budget letters we're doing now is for your employee compensation, all the bargaining unit contracts that were signed, different bargaining units got different percentage raises. We have to build those into your budgets. We make adjustments for retirement rate contributions because those change yearly as well, among other changes we need to make. So that's what we're doing right now. We're building your budget. So what you see on in front of you in your projections and in your fund condition is based on what's in the Budget Act. Once the governor's budget is released on January 10th, those numbers will be adjusted. Those can't be disclosed. They're confidential until January 10th when those do come out. So when I come present after January 10th, I can give you your new numbers. So with that said, you have two documents in front of you. You have a expenditure projection, which looks like this here. The expenditure projection shows your prior year expenditures. It's the first two columns there. The first one is your actual expenditures through preliminary FM12 report. That's through June of last year. The budget, due to our change, our transition to fiscal, is not projected to close until March, but these are the numbers that are in the system we have. But these numbers may be slightly adjusted when we do close. And then the column next to that is the prior year expenditures through FM3, which would be through September 30th of last year. So that's where you guys were at September 30th of 2017. Now moving to your right, you have your Budget Act appropriation. That's your actual budget for this year prior to all the changes we're making at this time. And then the column next to that is your current year expenditures. That is your expenditures through, it's through September 30th. We're able to pull a activity log from the fiscal system that shows every transaction that has occurred for your program. So what the budget office does in lieu of receiving the monthly reports that your board previously received in prior years, we're actually able to pull this activity log. We're able to sort all your expenditures by program, by line item, and that's how we are. That's how we filled this sheet out based on that activity log. And then your projections for the year. There's a few different methodologies we use for your personnel services. In the budget office, we keep a position report for every program, because at the beginning of every fiscal year, one of the drills we do is we reconcile all your positions, what we anticipate you're going to spend, and then that's how we project out your personnel services and your benefits. Now, for the other line items, those are typically done either by a straight line based on what you spent at this time through 3 months, and then we'll project that based on the average you spent monthly, and then we'll project that out for the year. Or if it's more appropriate, we'll do a prior year ratio where we looked at what you've historically spent, what your trends are, and then we'll project that way. So with that said, you're projected to save about $243,000 this year. That's a healthy savings for a program. We have zero concerns for your program in terms of your spending. And additionally, as I mentioned earlier, once January 10th comes and the new governor's budget's released, all your incremental changes will be included in your appropriations. You will have additional funding as well. So that projection may increase based on the changes we made, primarily due to that employee compensation. Because in here, your employees, it is showing their raises they got, like those expenditures are coming in, but the additional appropriation is not included, but that will be included once the January 10th release comes out. Does anyone have any questions at this time? Yeah.
It's actually about the second page analysis of fund conditions, so should I hold on to that question?
Yeah, I'm going to present that one next. Okay, so the next form I have is your fund condition. Now the fund condition, if you move from top to bottom, there's 4 sections of the fund condition. The top section is the beginning balance. That is your starting balance for your program for every fiscal year notated on here. The second section is the revenue section. That shows all the revenue that you've received in prior years, and then what we're projecting that you're going to bring in for any future years. This fund condition includes your what's called your workload and revenue projections. Those are projections that are provided by the program, and our analysts work closely with the program to ensure that those projections are on par with what we expect to come in. So these do include your fee increase that should go into effect in 1920, I believe. Actually, I think it's January 1st, 19, I believe. I'm sorry. Midway 1819 and ongoing from 1920 on. What this doesn't include at this point is I know we're going to seek legislation for. It sounds like for a potentially seek legislation for the schools. This doesn't include that. Once that legislation is introduced, if it is, then we will work with the board to ensure that we project out your revenue appropriately. So the third section here is your expenditure section. Your expenditure section shows your appropriation for every one of those fiscal years. For the prior year, it shows your actual data, and it shows any direct draws from your fund. For example, for Fiscal, the new financial platform that all state agencies are on. There is a direct draw from the your program for that, and there's other direct draws in there as well. And then the fourth section is your fund balance. So the easy way to kind of look at the fund balance is your fund balance is your starting balance plus your revenue minus your expenditures for every year. Then you get your fund balance. And then based on that fund balance, you have your months in reserve underneath there. And the months in reserve, if your program was to stop bringing in revenue starting today, your months in reserve is how many months your board can sustain its current operations prior to becoming insolvent. So that's kind of an easy way to look at the months in reserve. And we have no concern. It looks like, based on the months in reserve, that your months in reserve are going down. But on these fund conditions, just be aware that on your fund condition, it assumes that you're only going to bring in the revenue that you projected and that you're going to fully expend your appropriation. And your board does save anywhere between $300,000 and $500,000 every year. So that expenditure section, that's assuming you're going to spend your entire budget. So this fund condition isn't necessarily a true depiction of what it's going to look like moving forward. So we have zero concern about your fund, and like I mentioned earlier, this doesn't include your potential legislation to increase the fees or add the fees for the schools as well, and that will be added in future years if that does happen. Any questions about this one?
Thank you. You answered my question.
Awesome.
I have a question.
Yeah.
So is your that we are potentially, seeking potential legislation regarding inactive licensees and possibly either maybe reducing those fees? Are you aware of that?
I'm not personally aware of legislation to reduce the fees for inactive licenses.
If I may, there was a bill that was chapter this year, SP or AB, I forget which, 1659, which allows boards to alter the fees for inactive licensees. It would become an issue before the board itself whether or not to actualize that. And this bill does go into effect in January 1. The board has, the board's legislative committee did discuss it a bit, and we'll probably present it for discussion, if not at this meeting, the following meeting. But we don't know, we don't have an actual plan. But I do know that there's a substantial amount of revenue savings should we enact that.
Yeah, let me add on to that. So every year we reassess your revenue with your program. So if your board does decide to implement that, that's something that on your fund condition moving forward will be adjusted.
For clarity, the cost savings, as you said, we always have savings.
Mm-hmm.
The majority of those dollars came from personnel?
Well, at DCA, we do bottom line budgeting. Yeah, based on how you're appropriated by line item. Yeah, like a majority of that, it appears, comes from your personnel. Now, what we do in the budget office during our budget building season, when we reconcile your positions, we also reconcile kind of your line items as well. So if we anticipate you're going to bring in more or less for your personnel services, we can do what's called a net zero adjustment to your budget. So we kind of realign your line items more appropriately based on your spending. So right now, based on how your appropriation set up now, it appears that it's coming out of your personnel services. But once the January 10th budget comes out, we can retake a look at it. And if our savings are coming from there, and board members, if you don't like to see the negative
reading
line
my
items for
mind.
balance, yeah. So we can realign your budget. So your budget, it won't change your bottom line dollars, but we can change it so your budget is more aligned according to what you're spending.
Right.
Yeah.
And particularly in line of what the EO just reported, we are now more fully staffed. And so cost savings from personnel because of not being fully staffed could have a net zero.
Yeah, well, we did our projection based on your position roster, so we have all of your positions. So we actually projected it out based on you being fully staffed
Good.
with your current staff. So it should look very similar to what I have here, unless there are some reclassification of positions where maybe you reclass a position up or down, which could change the salary.
Which could happen.
Yeah, absolutely.
Thank you.
Yeah, you're welcome.
Thank you, Mark.
You're welcome.
Always good to see you. To transition, and the last item we have listed under my report is the BVNPT's transformation. But before I do that, I did want to apologize. We had put together the prospective calendar for the next 3 years for the board, and I somehow neglected to have that uploaded. My apologies. But the most important thing right off the bat is our coming meeting in February. We had tentatively thought to go to San Diego, and we've been encountering some issues in the planning and execution of that. So it looks as though we will not be in San Diego itself. We will be in Southern California. We're looking at some places, in both Los Angeles and Orange County. We will be updating the board as soon as possible between meetings. We'll probably settle that in the next couple of weeks, and we'll be sending that out. So now, before you is, I think, a little presentation, I think, on the way BVNPT has evolved, cleaned up, and moved forward this year. Vicky's been working very hard on this. We put together a slideshow showing some befores and afters. I think the board members should be able to see it on the monitor in front of us, and I believe the audience should be able to see it on the hanging screen. Vicky, do you want to go ahead? And technology has tripped us up.
Yeah, hold on one sec. I apologize for that. There we go. Just to kind of lead into this for a minute, one of the things that Elaine talks about all the time is the structure and the foundation of BVNPT. And what we learned is that our foundation and our structure is embedded within our staff. They are an incredible group of people. They show up every day. They have a good attitude. Their morale is on the upswing. And candidly, we're having a great time. Just to build on this, Elaine took this position, and her first day of work was January 22nd. Within 16 working days, she held interviews for the AEO position, which I actually got. The interviews were on February 12th. She offered me the job on February 15th, and she made a final offer on February 21st, and my first day was March 1st. And the reason I'm telling you that is it kind of leads into the next slide, is what happened on March 5th. Our board president and vice president were invited to a joint sunset review oversight hearing at the Capitol. And I think for the most part, they were encouraged to make sure that BVNPT was a success. So I know that our president and vice president spoke about, how they were going to help all of this happen. And, Elaine had been there a month and a half, and, she was kind of called out and said, what are you going to do to make it a success? So this is kind of our success story and how we're transforming BVNPT. So when you first walk down the hallway to BVNPT, you see a sign. What I decided is that we need to tell you a little bit about coming into our office and what to expect. So we're telling you what our office hours are, and we're telling you to come on in, sign up, and have a seat, and our nice people will be with you in a few minutes. When you first walked into our lobby in March of 2018, it was kind of disgusting. My first day, I walked in and I saw this computer in the corner, and I'm like, what does that do? Apparently it didn't do anything because it was broken. And there were some really nasty stains on the carpet, and the ick factor was really kind of high. And I thought, this is the face, this is the first impression that our applicants and licensees get when they walk into BVNPT, and quite candidly, this isn't acceptable. So we worked kind of hard and decided that we're going to transform our lobby. They kind of laugh at me because I have some really cool music in there now, It's from a CD called Liquid Minds, and as one of our reception staff said, it's very calming. People are nicer now. So one of the things that we did with that computer is we told people what you can do with that computer. You can actually log into your Breeze account and take care of business. We actually have a 50-inch monitor in there that talks about frequently asked questions. And it also has very motivational, in fact, Samantha, there's one up there for you. It's about psychiatric technicians for you and Paul. And we bought comfortable chairs. And so we actually have a lobby that people feel welcome to come in and use. The next thing that we took on is the CE audit room. There was a failed CE project, and the end result is that there was an office that was locked, and it had a minimum of 112 postal tubs from the post office, and they were filled with all of the incoming and returned mail from the failed CE audit. What we decided to do was liberate that room. So I unlocked it, and I told people, I said, start cleaning up around your office. Let's start filling up this room and get everything in there because we're going to have a shred day. Well, we worked long and hard and got a shred contract. So on March 23rd, we had the shred guys come in, and they started at noon. They started hauling out all of those bins. They actually dumped them out, and then they dumped out all of the cardboard boxes. And as they started to haul things out, we saw office furniture. We didn't know what we were going to find in there, but apparently there was a nice chair in the corner. They kept taking things out, and all of those mail tubs were slowly returning to the U.S. Postal Service. And we actually had our manager, Rochelle Lee, that many of you have met, actually moved into there at 3 o'clock that afternoon. So that is a huge transformation. That day, we had 250 boxes shredded. Then we kept going. We had a third-floor file room, and I was able to take Mr. Durkeen and Ms. Turner on a tour up there when they were in town for our ledge committee. We actually had 158 boxes of licensing files, active licensing files, that had been prepared to go to the State Resource Center, which you really can't send active licensing files to an archival system. We had these old cabinets. There were 35 filing cabinets, and they had obsolete information from our enforcement. There was some stuff from licensing. And we also had a lot of broken down and worn office furniture and modular furniture up there. So this is kind of what it looked like. It was a hot mess. In the top left-hand corner, those are the actual filing cabinets. And again, we started going through these rooms and putting things that needed to be shredded. We were finding documents from the 1980s, the 1970s, that were just nonsense. It was something that wasn't useful to us. The top right-hand corner, those are the 158 boxes of our active licensing files. And on the bottom row, you see some pictures of some of the old archaic equipment. And yes, in the middle, that is an actual typewriter. Some of you know what typewriters are, some of you may not. But there was a typewriter up there. So we did liberate that too. One of our enforcement managers, Matt McLean, and his team took all of the information out of those filing cabinets, and they had to go through it to make sure that it was either recyclable or it was confidential information. So they took a day and they loaded up the boxes and they took them back up to the file room. So then we started piling all the boxes in there again because you know it's coming up, shred day's coming up. So actually Jay Prouty, who's here with us now, and one of our other managers, Rochelle Lee, they were up there one day getting things ready for our shred day. The middle picture shows we had 13 rows of boxes, 3 across and stacked 5 high. And that was just on that side of the filing cabinets, because on the other side of the filing cabinets, we had more stuff. That day when we had our shred day, they shredded 306 boxes out of the third floor file room alone. So that was bringing up our total of shredded boxes since March 23rd up to 556. So this is kind of what it's looking like. The file room's looking really good. We purchased these filing cabinets, why buy new? We got them from state surplus. We saved some good money. And the 2 ladies pictured here is Pia and Erin. They're the 2 that said, hey, we'll take this on. And they did an incredible job. And they continue to go through BVNPT and find different hot messes. I guess that's the best thing. Again, this is our third floor file room. It's completely transformed. They also took the files. This is our second floor file room over here. They actually took a lot of the files out of there and put them up on the third floor. So we now have room on the second floor for the incoming licensee files for our applicants. And then We did another shred day, of course, and we took out 168 boxes. So we're up to a total of 724 boxes right now, as of today, leaving BVNPT. So we found out we have a storage locker, you know, the public storage type of places. It's about 1.5 miles from BVNPT, and they just have stuff stored in there. So Aaron and Pia and our mailroom person, Todd, have made this their project. We're going to empty this out and get rid of it. We are currently paying $560 a month for this room, and Pia said they've had it at least 10 years. So we've been spending over $67,200 to store supplies off-site. So we are really making strides in taking stock of what we have and what we really need, and in this instance, where we're going to put it. So we actually found places to put stuff. For example, some of the items in the storage, we had forms and applications with Arnold Schwarzenegger's name on them. They found boxes of stuff from the 1960s. So it's been interesting because, you know, any morning Elaine can walk in and find a box on her desk with new treasures, and we're trying to figure out if some of those things might go to the state archives. When Mark talked about our budget and there were some of the salary savings, we actually took some of those salary savings and we did a really good investment. We invested the money back into our staff. Now, some people say, oh my God, you spent new chairs and you're going to charge a fee for our applicants and licensees. Yeah, we actually did, because the people that are processing those applications are the people that need to have a safe, comfortable work environment so they can continue working day to day. So we bought new chairs for everybody in the office. We bought sit-stand desks. And we bought dual 24-inch computer monitors. We also put video conferencing equipment in both of our conference rooms. And one of the things that we're starting to do is have video conferencing with some of our board members. And our NECs are using it all the time. So in June, I call it a chair rodeo. We rounded up all the old chairs, and we actually called the Elk Grove School District, and they said, yeah, we'll take your chairs. So they borrowed a truck from some teacher's father, and they came out, and we loaded up a bunch of chairs and donated them to the Elk Grove School District because they didn't have chairs and they would take anything. And ours were kind of the, wow, you're going to take these, but thank you. So we are very thankful to the Elk Grove School District. This picture shows the sit-stand desks over here and the dual monitors, and this is actually at our front reception. And this is one of our team members who's actually, it's her last day today at BVNPT. She got an incredible promotion at another state agency. But this shows Catherine standing, and basically I heard this, that sitting all day is the new smoking. So as healthcare professionals, I'm sure a lot of you in the audience can understand that. This is an example of our video conferencing equipment, and these are the people from Solid doing one of our team meetings. They were actually doing the strategies of team development with our team. When Elaine talked about our organizational change management team, this is Dave, who's actually sitting in our office today. And this is one of the mapping processes that they were doing with 2 of our team members here. So the video conferencing equipment is fabulous. They use it for onboarding, again, Skyping. It's an incredible thing to have at BVNPT. And again, here's a picture of our NECs having a Skype meeting. And according to our NECs, they want a YouTube channel because they want to be able to take the technological advances and use them with the directors and have a YouTube channel where the directors can go on and see exactly how to fill out the application, or if there's anything else, any other burning issues, or when the nurses see several deficiencies with some of the directors, they want to produce a video and the directors can see it. And I'm sure the directors are going to be asked to give a lot of input on this, so we're very excited about that. The other thing that BVNPT doing is using the cloud technology. The schools are using it to upload their school information. This is Vicki Saavedra. She'll send out an information to the directors when you have a school that you're graduating. It's cost effective. We don't lose your documents. They're not damaged. Your applications are processed quicker. It protects the confidential information. The reason why we say it accelerates the employment process is because we have everything all together. We don't have to do this back and forth asking you for different documents or requesting those from your students. Potential increased examination passage rate, again, it's the same theory. If we have everything, we can get these people moving quicker. And people seem to like it, so we're happy about the stakeholder satisfaction. We have nearly 60 schools using the clouds immediately after they graduate their new classes. The Enforcement Division is using the cloud drive to send the disciplinary files to our board members. This saves hundreds of dollars in postage and maintains the security of the information. We don't have that stuff being sent out by UPS or FedEx, where there's a possibility where somebody could steal that information or it could get misplaced. So we're very excited to use the cloud technology. BVNT is a fabulous place if you're a soon-to-be mother. We had the prospect of 6 new mothers expedited the creation of a lactation room. So we actually have this to be able to offer to some of our new mothers at BVNPT. It's an office, but it works. We're excited to have it. In June 2018, we figured out a way to actually make a break room. We have over 70 employees, and the thought of eating lunch at your desk one more time is probably not very encouraging. So we started the process of creating a break room. We had a bunch of modular furniture taken out, and you'll see in this slide there's this weird line. That's because they only paint that far up to modular furniture. So when we took out the modular furniture, you could tell exactly where it was. So we were able to get the break room painted. We put tables and chairs in there. We had a fabulous bake sale in there to raise money for the holiday committee. And boy, they do great bake sales at BVNPT. So the break room, we're starting to use it. I think it's a success, and it's a nice place for our employees to take a break. In June, we had a staff appreciation lunch. Again, it goes back to we've got to feed our foundation. And our foundation is our team. They do an incredible job, and we just wanted, as the management team and executive management team, we wanted to say thank you. So Elaine paid for the taco guys, and the managers and I pitched in, and we did drinks and all the fixings, desserts, all the plates and everything. They did have a water feature, and Jay was seen running through that. A couple of our managers decided, it's really hot. I think we need a break. We had great participation, and we were able to have a great day and kind of bond. There's Rochelle, one of our other managers. She's enjoying the fountain too. In September, Governor Brown actually signed our fee bill, so we're very thankful for that. There was a lot of work that went into it. They had to do a lot of research. They worked with budgets to find out what our fee structure is and what it's going to be, what it is before we get the money approved or before we get the bill approved. So they did a great job. So it's going to be enacted January 1st, 2019. Again, this is one of the charts that Sam and Tim put together to kind of show what's going on with everything. The other thing that we're doing, BVNPT is really working hard with the other boards and bureaus. These are 2 different meetings we had with our respiratory care boards. And they wanted to discuss the scope of practice issues and determine the best way to establish a collaborative approach to educate the healthcare industry on how the 2 practices intersect. We want to make sure that the Respiratory Care Board is fully cognizant of the scope of practice for LVNs and PTs, and everybody just wants to make sure that we're able to educate the healthcare industry so that they make wise hiring decisions. And in our enforcement break room kitchen and in our break room, we have suggestion box. So we ask people if there's something on their mind, if they have a wild and unusual question, or if they have a wild, unusual idea. We want them to write it out, drop it in the box, tell us who you are, remain anonymous, but we want them to help us make BVNPT the best. So that is kind of our BVNPT transformation. So far, thanks, Paula.
Thank you for that. So we'll move on to the executive committee. Through the executive committee, we are working on the per diem rates so that there's more accountability for us as board members when we're turning in the accountability form or the per diem form. Along with that, we're working on updating the board member manual. And as Elaine said, the updated board calendar for 2019 through 2021 was not put in the packet. But we do need to, the upcoming board meeting, February 21 through 22nd in Southern California, as she said, it's probably going to be moved to Orange County, LA area versus San Diego. The next meeting after that for 2019 was May 15 through 17, and that's going to be up here in Sacramento, with the first day of the three-day meeting being working on strategic planning and team building for us as board members. Now, the August meeting in 2019, we needed to make a proposed change for the date from the 21st through 23rd to the 15th and 16th. Due to the National Nursing Board Council, that's the annual meeting for that, from the 21st to the 23rd. So that would be a change in our meeting dates. And then November's board meeting for 2019 is the 20th through the 22nd. And Elaine can email us out the actual dates this afternoon, or a copy of our proposed dates. In 2020, February meeting will be 20 through 21. May will be 20 through 22. August will be 20 through 21. And November's would be the 18th through the 20th. And one other item that they're looking at in 2021, they're looking at trying to include Central Valley. So instead of having the meeting in LA, for Southern California, possibly doing a meeting in the Central Valley. So 2021 proposed dates are the February 18 through 19, May 19 through 21, and that would be in Sacramento, August 19 through 20, and that would be a Southern California meeting, and then November 17 through 19, which would be up here in Sacramento.
Madam President?
Yes?
Regarding the August 2019 meeting, even though some of us may already have planned our schedule, I think it's very important that we do move it to allow you and our executive officer to attend the National Council. I think it's very important that this board is represented on the national level.
Thank you.
Madam President?
Yes?
Based on that, I move that we officially change the date of the August 2019 meeting to, and make sure I have the correct new dates, are August 15th and 16th.
I second.
So it's been moved and second. It was moved by Bernice and second by Samantha to officially change the August meeting date to August 15th through 16th. Is there any discussion by board members? Seeing none, any public comment? Seeing none, we'll do a roll call vote. Paul?
Yes.
John?
Yes.
Paula?
Yes.
Bernice?
Yes.
Myself is a yes. Ken?
Yes.
Samantha?
Yes.
Alita?
Yes.
Cheryl?
Yes.
Okay, it's unanimous, motion carries. So that will be reflected on the dates that we'll send out to the board members. The next thing is a strategic plan. And we have somebody from Solid to come talk to us about the strategic plan that we worked on.
That's, is this one?
We have, who's it, Dennis? We'd like to welcome Dennis Sanchi.
Actually, Zenke like cranky.
Oh, thank you, and welcome.
All right, thanks for having me. So I'm told I'm supposed to give you a short overview of the SWOT analysis and the format that we do. I think originally you all were thinking maybe having some input or some questions. So the format we use is SWOT, which is strengths, weaknesses, opportunities, and threats. And we ask those of all the board members. You all would be interviewed, and we'd ask you, what do you think the strengths, weaknesses, opportunities, and threats are of your major program areas, which are licensing, enforcement, that kind of thing. Then we would do the same for the executive management, and then the same for the staff. And then we also send out a survey to all the stakeholders, and you all would choose the stakeholders. Usually they're licensees, consumer groups, college or professors, people who teach in the profession, and potentially professional associations. And they would get an online survey that would ask them what they think the strengths, weaknesses, opportunities, and threats are. We have them rate each area by poor or very good, good, poor, very poor. And then we also include a place where they can write out or type out their statements. And so you'll have an idea of why people feel the way they do. And that whole format for the SWOT is the legislature, Department of Finance, and even DCA. That's the format that's recommended by the Department of Finance, and that's what our audits team uses to determine whether a strategic plan is what should be according to the legislature and the Department of Finance. Any questions about that? Any clarification?
Yes, thank you very much. Further clarification, you mentioned on this, there are already developed questions on the survey. Is that correct?
Yeah, so we've actually used them for at least since 2012, all the boards and bureaus throughout DCA. So we've used them for each board and bureau at least twice, some 3 times.
So you're telling us they've been validated?
Very much so, yeah.
Thank you.
Yeah.
Any other board members have questions?
Thank you, Madam President. Just a quick update on where we are personally as BVNPT on the process. I think the board members will recall that we've been having some discussions. We had a really great workshop this Wednesday. I wish all of you could have made it, but those of us who showed up, there were some really good conversations. It's very exciting for us. But where we're moving forward is, as Dennis was outlining, our next actual step will be to launch this survey. We'll be processing that information. We want to, of course, continue to do work with the board members themselves. I think the big, steps forward we took this Wednesday was we looked. God bless you. We looked quite critically at our mission, vision, and values. I think we spent a lot of time, the staff and the management spent a lot of time with our consultants from Solid, who, by the way, have been tremendously helpful and very insightful and kept us moving along very efficiently. So the staff went through a lot of sessions together where they brainstormed a lot and they thought through what our mission, what our vision, the things that made us work, what the reason for having BVNPT is, and what the values that drove us should be. Put together a fairly solid draft. Again, I apologize for keep using the word. And then the board members on Wednesday looked at it. We also had some of our staff and managers along to provide some input as well to really, I think, fine tune. We'll have a draft to send out to you today, really. But so those of you who are traveling and check your emails later, it may well be there. But more likely, you'll see them Monday. And we'll be moving forward with those as kind of our guideposts right now. And as I said, the next big step will be to refine the survey. And I think what we do really need board input on is the list of stakeholders to whom we're going to send the survey. The calendar we'd like to uphold here is to have the survey actually out into the field in early December and then back for tabulation and analysis in early January, so that we would have, I think, some very, very, very good foundations of information to work for when we meet again in February. I think we would have some discussion, and the board meeting itself, we won't be able to have our third day where we spend a large amount of time together just building that, but we will have some time to discuss. So that would be where we are. I think overall, what we're looking to do is have a strategic plan draft for you to approve by the August board meeting. And now remember, this plan would be our guidelines for the work we do between 2020 and probably 2023 or 2024.
Yeah, we usually say 3 or 4 year plans.
Right.
And one of the things we'll do, if you all decide after you approve the strategic plans, we can come back with the staff and do action planning, where you all set the objectives of what you want to happen in, say, legislation, enforcement, licensing. Then we come back with the staff and say, what are the actual tasks? Who's responsible on the board staff for doing it, and what date will they do, so that you can have a kind of a temperature check of how things are unfolding.
And then Dennis, I have a question for you. The survey, is it compliant with requirements of oversight from our oversight agency also?
I'm not sure what you mean.
So it would be DCA, agency?
Oh, for sure. Oh, yeah, yes, absolutely. Yeah. Yes, for agency, legislature, department, yeah, absolutely, it would meet their requirements. In 1998, the Department of Finance set up some guidelines for doing the strategic planning, and that's what pretty much everyone in the state uses, and that's the guidelines that we use.
Okay. Any other board members have questions? Seeing none. I have a question for Ken. So as far as getting input from board members for the potential stakeholders, a one-way email from board members to Elaine, is that appropriate?
Yeah, so, thank you, Madam Chair. A one-way communication with the executive officer would be an allowable way for that information to be submitted. However, it would be impermissible for the communications to go out in a spoken will type arrangement, so that there's indirect communication between board members.
And one of the things we can actually do is we, for most board members, when we do the SWOT analysis, we usually set up 45-minute one-on-one phone calls with each board member, so that we can gather our information individually from each of you.
And that would be in the context of the environmental scale.
Yes, yep.
Okay. Any other questions? Bernice? No?
I believe we used a term that everyone might not be familiar with, environmental scan. I mean, some of us, if you do survey work, you understand. But because we want our stakeholders to be actively engaged in that, would you just take a very brief moment?
Very brief.
And define environmental scan in this context?
All right, so the environmental scan is going to be a summary of what all the stakeholders have to say and what they feel about the board and the different areas like legislation, enforcement. And you can think of it as kind of for the board members and for the stakeholders. It's the pulse of what are people thinking right now and how are people feeling right now about the board. The quantitative scale, how do we like them? And then the qualitative, what are their feelings and thoughts behind it?
Thank you.
All right, you're welcome.
Thank you, Dennis.
All right, you're welcome.
And we need a motion, do we? Yet, the questions haven't been sent out to board members. That's what should have happened Wednesday evening. Okay. So, if I may, make a motion to have questions reviewed, the standard questions reviewed and approved by the executive committee to be sent out to the stakeholders who will be determined.
Will be determined. Oh, the stakeholders
The
to be
stakeholders
determined.
to be
I would so
determined.
move.
Thank you.
Do you need a second?
Cheryl, second. So it's been moved and second to approve have the questions approved and sent out to the stakeholders who will be determined. And any other discussion by board members? Seeing none, we'll do a roll call, or any public comment? Seeing none, we'll do a roll call vote. Paul?
Yes.
John?
Yes.
Paula?
Yes.
Bernice?
Yes.
I'm a yes. Samantha? Oh, Ken? I
Yes.
got them switched. That's why. Samantha? Yes. Alita?
Yes.
Cheryl?
Yes.
So I have Samantha first and then Ken. Sorry. So the motion carries. And with that, that is the executive committee. We'll move on to the education committee. I will turn it over to Bernice.
I just have one, I'm sorry. I
That's
didn't know
okay.
we were finished with the executive committee report. I just have one question regarding, I noted at item 11, there's a mention about who determines the executive officer's salary. And it was suggested that only one individual, our president, who I have every faith in her discretion and her decision-making ability. But I just needed to comment that I think typically at least an executive committee would be the ones that would make that decision, if not possibly the entire board. It seemed like with Ms. Anderson, we did vote on the increase in her salary as a board.
Yeah.
So
Oh,
I just wanted to note that.
I think you might be talking about the per diem.
Oh, is that the per diem, not the salary?
Yeah, so the recommendation, and it hasn't been finalized, in February, we're going to bring that back to you. It would be all in the board member manual and the updated per diem form that we would turn in for more accountability for us as board members. They want to change it from the EO signing off onto that to the board president signing off on our per diem and our travel forms.
Okay, so you're talking about the board member per diem and not
Yes.
the EO per diem?
Yes. Sorry, I
No,
should have
it's
been
my-
more clear.
Yeah, it's my interpretation. All right.
But yeah, that's the update that we want to do, because I believe a lot of the other boards, the sitting board president is the one who's been signing off on the per diem forms and the rates, or the expense claims.
All right, you've clarified it. Thank you.
So Samantha?
Yeah, I was just wondering, I saw that also in the packet. I was just wondering, is there a specific issue with it that we should be made aware of for our per diem, or is it just some cleaning up of the policies?
I believe it's cleaning up of the policies. You know, for an example, it was the day that we were at the Respiratory Care Board. There was a comment made to that board president as to asking about the expense forms and signing off on them. So I had wondered why, because with us, it's always been the EO. But with some of the other boards, it's the current sitting board president that has been doing that. So, any other questions?
But so the amount is set by currently?
The amount is set by, I believe it's the statute.
Okay.
Yeah, but as far as the, you know how when we turn in our form, the process of what we do, what form we fill out, what days, what we worked on?
Yes.
That form in order to get reimbursed and the per diem rate paid.
Madam President, and just for clarity, and if we think about it, who reports to whom? is actually the case. And would someone who is not in the position of being supervisor or major recipient of reports, should they be placed in the position to sign off? And so what our president is talking about is how do we clean up the process to fix it?
Sorry. So, any other, that is a very good question. Any other questions? Seeing none, we will move on to Education Committee.
Thank you, Madam President. In the packet is the full report, which is labeled 14A. As the chair of the Education Committee, along with my colleague, Ken Maxey, we held a meeting on November 16th, which always is a public meeting, and I'll give just the highlights. We did some update and discussion around strategic planning. And as Vice President, I have been charged by the President and the board to make sure each committee understands its charge. And in this case, we talked about for the Education Committee, its charge. It was read and discussed in the Education Committee. The charges have been in print and are part of our handbooks. It's just helpful if we sometimes go back and review them so that we keep our business related to the committee's charge. There was a discussion and some action recommendation around Integrity College of Health Vocational Nursing Program. We had a presentation there, and based on the presentation and the comments by our NEC, Ms. Gomez, the committee moved to accept the report as written and to present it to the full board for board action. And it is part of our packet. I believe there is someone present from Integrity College of Health Vocational Nursing Program. And with the board's permission, we'd like to go on and just handle that. Good morning. Ms. Gomez, will you give us some background, please?
Yes, thank you. On June 5th, Integrity College requested to start a class. And the class they wanted to start was for 20 students that would start on July the 30th. During evaluation of the information that was presented to us, it was identified that they did not have adequate faculty or facilities to offer that class. It was determined that we would make an on-site visit to see the college at the end. So on August the 2nd and the 3rd, we did make an announced visit. The reason it was announced and not unannounced was because we had a brand-new director who had only been a director for about 2 days, and it would not have been fair to her to make it an unannounced inspection.
Thank you.
And so on August 2nd and 3rd, we did make the inspection. We did find 3 additional violations while we were there. And these violations were all concerning adequate resources. They did not have the resources that were needed. The resources that they did not have was facilities for pediatrics or for OB. Their students had in-class skills lab through that process and had not had any hands-on experience with this with pediatrics or with OB. And so This was for the 2 current classes that were going to graduate in October and in November. And and they had already passed through that program. And they, on September the 10th, they were sent the information, August 10th, they were sent the information about the violations. And on September the 10th, the owner of the program called me. And she said, yes, that there had been some issues. And I'm sorry, I did miss one. There was a complaint that they had instructors that were not board approved teaching. And the owner called and said, yes, I'm sorry, my daughter did teach classes while I've been out ill. And apparently the owner is still out ill, and that's why we have the new director. On October the 1st, the program was placed on for the Education Committee to evaluate. So our recommendations is to place the program on provisional because the students had not received the pediatric and OB.
Thank you. Comment from the school?
Yes, good morning, everyone. I am requesting that you do not place us on provisional. So here's my take on it. I am very new, I'm still learning, but I've been working very hard to get everything up and up. Let's just say that I now have 5 maternity sites that are active. I have 2 active pediatric sites, and Mrs. Gomez will be receiving another application for a pediatric site. And these sites are all very, very good sites, subacute, beautiful facilities for critically ill and fragilely ill, technologically dependent children. And I've added, I currently have 4 different skilled nursing facilities and 1 subacute facility for our med-surg students, and I have added 4 staff members. So I think I've corrected that violation, I hope. And she has asked me to show where each student has been from the beginning of the program, and I am currently working with that, showing every hour, every place they've been, and the last thing she said to me was, I want everything. And in the process of giving her everything for every student, it has now taken me anywhere from 274 pages to 300 of scanned documents per student. And it's not that I didn't want to give it to her, it's trying to figure out how. So today we're going to see if I can email her all those packages, but I have done my homework. These students that she is talking about have had plenty of hours of active hands-on pediatrics and maternity. I have corrected that issue. Number 3, that was the problem with number 3. So I'm working on that, providing her proof. I believe I corrected number 4 violation. And as far as the owner getting sick, she is still ill, but her daughter at one point did teach back in the day, and she has 2 masters, and she is quite brilliant and knows the ins and out of nursing, and at one point was a registered nurse. However, she has given her RN up, and I have now found out that before I came along, that she may or may not have taught classes. As far as I'm concerned, when I came on board, none of this has happened. I've been doing the best I can to keep everything on the up and up and follow my P's and Q's.
Thank you. Ms. Gomez, as of this time, is there evidence for change in your report or recommendation?
No, there is not, and the reason is I still have not received the information about the students, and these students were supposed to graduate in October. They're not being allowed to test because we don't have the information. And the school kept the information away from us, that they did not have clinical resources. And so it would be my hearty suggestion that we do keep them on, place them on provisional, just to observe them, to make sure that they do follow the regulations, since it was their practice before this new director that they just did not give us the information when they were lacking resources.
Thank you. The motion from the committee to the board is to accept the report as written and present it to the board for board action.
I have a few questions if it's time.
Yes.
Good morning, Ms. Gomez. I see on the introductory page of our packet, it says on August 10th, the program was sent a notice of violation and was instructed to respond, and then a 1-week extension was given. And this says, however, to date, the program has not provided the requested response.
She was showing me some of the information today, and so to have all of the information, no, I do not. Some of the information I have gotten, but not all.
So, I mean, it's good that you brought it today, but it's not really sufficient. It should have been given to Ms. Gomez previously because, that has to be reviewed. But what you're saying is you've received it today then? And
I have not received it. We're trying to figure out a way for her to give it to me.
So I would ask the representative from the school, why wasn't it submitted? You had since August 10th, so why has it been so?
The school decided to change their attendance tracking system. It's a new system, and we've had a change in our staff and trying to keep information from one, passing it on is another one, and another problem. And we have tried to make it easy and bookmark all these pages and everything. And that process of trying to make it easier for Mrs. Gomez to read has really taken a lot of time. So maybe today we can discuss a way to shorten that.
Yeah, because it's really important that the responses or reports, they have to be turned in on time. And then there was even an extension, but yet the information didn't come until today. That's concerning.
I must say that at the time she requested it, I was still in the process of trying to get the students the information. So if I had provided her with the sheets then when she asked, it still would be incomplete. It is just this week that it is finally complete because I've been able to get all those students. And some doctors' offices will only take 2 maternity students at a time. So it has been a long, challenging process, but they are all well educated and they could work at any OB office in any state.
Speaking of the students, Jessica said something in your opening that there were not adequate OB and PEDS facilities, and the students actually had no hands-on experience. The students that were set to graduate had no hands-on experience with OB or PEDS. That's very serious because that means a person would be graduating and could be a potential danger to the public, which this board is tasked with protecting. What has happened to the students now? Have they graduated? Because
These are the students that we are talking about currently. There was class 33 and class 34. These are the students that had skills lab with a mannequin and we're revising this whole simulation thing. So I was the teacher that taught them as far as pediatric skills and obstetrical skills. And since I am a pediatric nurse and an obstetrical nurse, they have adequate skills. Now, will they ever get to see a mother actually give birth? I would say most vocational nurses don't even get that opportunity, but my students do have the skills. So what happened to them? I secured sites and they had a teacher on site, and they spent many hours in obstetrical clinics and pediatrics, either subacute facilities or a doctor's office. So they have had their hours, and these are the two classes that we're holding right now and we're discussing today.
So Skills Lab is good. Skills Lab is good. However, we know that it is not appropriate or does not meet the regulations for students to complete clinical experience only in Skills Lab. They do need the hands-on, even if they have a great teacher, even if they have an experienced instructor. Just Skills Lab is not appropriate. So when were these students originally scheduled to graduate?
I believe it was October 6th for class 33, and now they have their hours complete, except for one student that has been sick, and she will start those this week, Monday. And as far as 34, class 34, they have completed their hours in both pediatrics and maternity, and they are slated to graduate next week.
So their graduation has been delayed, even if it's only by a month. That's not appropriate. That's quite an injustice to the students. When they're scheduled to graduate, scheduled to take their exams, then they're held back. That's something that cannot happen, and this board is tasked with ensuring doesn't happen. So it's concerning, and it seems like an injustice has been done to those students. So I'm glad to hear that it's being remedied, that they're going to get to graduate. Jessica?
One other thing, if you look at violation number 3 on page 7, they had 3 groups of students in different levels, all going to clinical site with one instructor, and there were over 15. So this is a very violation to our recommendation of 1 to 15, but also it places the students in a situation, and the instructor, that they're trying to learn at 3 different levels at the same time.
Yeah, that's why, there's different, there's progressive learning from 1 to 2 to 3, and that's why that's in our regulations. And just being above, having one instructor, there's either 10 or 15, depending on what has been prescribed for the school, is for a reason. So these are very basic things that should be followed and shouldn't be difficult to follow. I was quite shocked to hear that the statement about the owner's daughter just coming in and teaching. Even if she was a licensee before, even if she had taught before, that's shockingly inappropriate. You can't just put someone in and teach a class. It has to be approved by our board, by the NECs. They have to have specific training. I didn't honestly believe it when I first read it. I said, there must be some mistake. I mean, is this true that this would actually happen? And then I hear that it did. I mean, that's just a gross violation. That's more than serious. That's a gross violation. And I mean, this certainly just can't ever happen again. I think it's really shocking in its inappropriateness. So I see that Jessica wrote in her report that it was with the best of intention, but it's just a very gross violation, and I hope that won't ever happen again at your school.
I'd like to respond to that.
Sure.
As far as I didn't imply, or I didn't mean to imply that any time on my watch when I have been the director, did she ever teach. It may have happened years ago when she had her current RN and she was approved by the BVNPT to teach. So at no time did I indicate that she has taught on my watch, and I was aware that she taught.
So this didn't happen in September? Because Jessica, from your report, it looks like...
I received a complaint in September. from students who were complaining that she had taught.
Current
And
students?
from students.
Current students?
Yes. And I received a complaint on Monday from a different student. The others were males. This is a female student who complained that she taught her fundamentals, and she's a current student.
Recently?
It was, she had failed out of her fundamentals, and so she was in the 33 class and is now in one of the current classes now. And so, yes, and Bella was not, or the owner's daughter was not licensed at that time or approved.
I'm glad to hear that you're working with the school, and it seems like you have a good working relationship with Jessica, so I hope that you'll really work with her. I feel like she's being generous with your school because of these serious violations, so hopefully you can get these things remedied and the provisional will help.
I hope I'm working with, yes, Jessica. And I do heed the warnings, and I do understand the significance of the problems. Again, it hasn't happened, and it won't happen as long as I'm director. And as far as your other comments, again, they didn't happen when I was in charge, and I have corrected everything. And I understand the significance of having different teachers at different levels and not having too many students and following the rules. I get that totally.
Great. Thank you.
And if I might add, we do understand when there is a change in leadership, the new leader suddenly becomes responsible for what was, what is, and what will happen, even though the new leader might not have authorized what happened. We cannot change the past. However, we are responsible for fixing it.
Thank you.
Other comments, concerns? Madam President, that was our motion.
There is a motion brought to us from the Education Committee, which is to accept the NEC's recommendation. Is there further discussion needed by board members? Seeing none, any public comment? Seeing none, we'll do a roll call vote. Paul?
Yes.
John?
Yes.
Paula?
Yes. Yes.
Bernice?
Yes?
I'm a yes. Samantha? Or
Yes.
Ken?
Yes.
Samantha?
Yes.
Alita?
Yes.
Cheryl?
Yes.
A motion carries. Thank you.
Further information about the Education Committee. We did have several presentations from our EO, clarifications around some of the legislation and proposed changes. We're very appreciative of that time. We also had some public comment around the proposed of legislation that might request a charge for school review. The next meeting of the Education Committee, which is a posted and public meeting, generally held in Sacramento, will be January 18th of 2019, starting at 2 p.m.
Any questions for Bernice? Seeing none, we'll move on to the Education Division report. Jessica?
Hello, again. Usually our reports are for 3 months. This time it has been changed and the numbers are only for 2 months, but you will see that we've been still very busy during these 2 months. We have a total of 141 approved programs, which is 128 BN and 13 PTs. We have on provisional approval 13 BN and 1 PT for a total of 14, for a total of 155 programs that we're working with. We have a total of 54 proposed programs. 25 of them at this time are being worked by the NECs or the retired annuitants, and 29 of them remain unassigned and are going to be worked on as soon as we can get to them. We have received a total of 11 complaints that we have been working on. These are from either students or faculty. It could be from a facility regarding programs, and so 11 total there. We have had 551 requests from the programs, and this includes curriculum changes, approval to admit students, approval to increase class sizes, and other critical program elements. On August 1 through September 1, the Education Division has processed 392 requests for new faculty and 363 requests for clinical facilities. We have had written 40 board reports. 32 of them went to the executive officer and 8 of them went to the board meetings. We have had 6 on-site program inspections that we have gone out to the different schools to evaluate. The Education Division conducted and attended 77 meetings, teleconferences, and with representatives from schools, board staff, and other stakeholders. We have received 2,889 pieces of correspondence via mail, fax, or postal service, and we have received 469 telephone inquiries, 1,893 written emails and letters, and 503 telephone responses. So we've been very busy during this time. Additionally, we've been working on top of that with the scope of practice questions, and we have had 192 scope of practice questions, 64 intravenous therapy and continuing education applications that we have approved, and 22 PT exam development actions that we have done.
Samantha?
Yes, I just have a question for Ms. Gomez. I see that there are 54 proposed programs. That seems like a high number. Has this number increased since?
Yes, they still are coming in.
It seems like maybe there are more programs being proposed than previous quarters or even years.
I can't give that. I don't maintain the list, so I'm sorry. I can't tell you if this is a big jump or.
It seems like it, and I know that puts a lot of extra work on you guys.
Yes, it does.
For each program. Do you have any idea, and you may not, once a program gets assigned, there's a lot of, there's an extensive amount of work that goes into, reviewing the design and back and forth and corrections and site visits and inspections. About how long does it take once a program is assigned to be approved?
It depends on the responsiveness of the program that we're working with. It took me a little over a year to approve High Desert Bakersfield, and it was just slow information coming in because they already had High Desert Lancaster. This one should have been a very easy one because they were using all of the same policies, procedures, and curriculum. But it was just the length of time it took for them to get it. So it depends. Some of them could be very fast. Some of them, the majority of them, take a longer time.
And I'm looking at your report and I'm seeing the great amount, a large amount of work that's on the NECs, and you guys are doing a great job. Do we still have NEC openings? I guess that's a question for Elaine.
We do actually have the SNEC and one NEC positions posted. The examination deadline for the SNEC, I believe, closes next week, and the one for the NEC will close, I think, the week following Thanksgiving. What that means is the folks who have applied for the exam will have their applications scored by HR, and I will be given a ranked list of candidates. And those who are deemed meeting the qualifications would be eligible to be interviewed and considered for position. I believe that we have the potential to make those hires in the next month or two.
Oh, excellent. So hopefully we'll have some help coming your way soon. Thank you very much.
Any other board members have questions for Jessica?
Yes, I do. Ms. Lyman mentioned the use of YouTube to provide information to those who need it. Have you started working on those yet, and what are some of your ideas?
We're looking at enhancing our director's, new director orientation. This is going to, we're going to continue with the one we have, but then offer YouTubes and also webinars to our new directors so that we can get the questions answered for them. I believe that Faye is going to be doing a YouTube very shortly that, on a presentation that she gave to one of the schools this last week. So we're starting.
Ms. Gomez? Ken, over here on this side.
Hi.
Hi. So in regards to the complaints that you do receive, what are the steps that are taken after that to, kind of answer those complaints and try to get back to those 11 complaints? And second to that question, is that a high number or is that a low number typically?
That's pretty much an average number that we're getting in. Each of us gets a couple. Now, there will be months where we'll get 5 or 6 from one school. So I think at one time I had 15 students complain about one school. And so the process is we have the students give it to us in writing, or the person give it to us in writing, so that we can make sure that we follow each of the items and that we are looking at each of the items and we don't miss anything. So we want it in writing. We then contact the school and tell them that allegations have been sent and that we specify what the allegations are, and we request documentation. Sometimes we do have to go out to the schools and do site visits, and several of the violations have triggered site visits. And then we get back with the school, we work with the school, and then we let the complainee know. We can't tell them an instructor was fired, or we can't tell them, exactly, but we can tell them that we followed up and that we did either validate their complaint or found out that it was just a student who wasn't doing well in the program and was complaining. So we found it both ways.
Thank you.
Any other questions or comments for Jessica? Thank you, Jessica. We'll go on to the 15B, reconsideration of provisional approval. If we could have Faye Silverman, the NEC, come up. Thank you, Faye. The board members have received and reviewed the report. Do any board members have questions regarding the report for the NEC? Seeing none, is there a representative from Pasadena City College present? And if so, if we could have you come up to the front, state your name and your professional title, please.
Is your mic on?
I'm sorry. My name is Carla Christensen, and I'm the director for the LVN program at Pasadena City College.
Thank you.
I'm Donna Nielsen. I'm the assistant director of the LVN program at Pasadena City College. Nice to meet you all.
Nice to meet you. Do you have any updated information or comments?
I would really only like to say that we understand the violations, and about 80% of them have been corrected since Faye made her visit to us, and she's been very helpful in guiding us through that process. And we were given a deadline of December 2nd, and we definitely will meet that deadline and have corrected the violations.
Absolutely.
And do you agree or disagree in regards to her recommendations?
No, I agree. Yeah.
Absolutely.
We're not.
I'm not contesting that. There were some areas we need to improve, and indeed we have, and we will by the due date.
Okay. Any board members have questions for the school?
I just have a couple quick questions. I was looking through your packet, and I see that you have great facilities. There's some pictures in here from Faye. They have great facilities. It looks like you have sufficient staff, sufficient clinical placements, so I congratulate you on that. A couple things I noticed I just wanted to ask you about. On page 7, it says that you were admitting students who didn't pass their entry exam. So an entry exam into the program, I mean, that's why it's called an entry exam, because you have to pass it to get in, but it says that some students were admitted that didn't pass it. What's that about?
Well, for one thing, we're a community college, so we also have chancellor's regulations to, abide by. And we really actually are not allowed to have an entry exam, so we handle it a little bit differently in that we accept students based on their prerequisites, their GPA, where they fit into that order. After we accept them, we give them a year to meet our what we say, we will not enroll them until they have at least a 58 on the entrance exam with the T's. So I did, because we had space, and I did admit a couple students that had a little bit less than that, but we're still doing well on reading comprehension, but they had a little trouble with the math. I didn't realize that I wasn't allowed to. And we had a lot of resource support for those students who had problems with math. We have tutors, and we have a whole math tutoring section available to them. And so just my mistake in not realizing that.
So full disclosure, I teach at a community college, so I
Yeah.
certainly understand the different
So you know.
requirements.
Yeah.
But that's not being done anymore, and you're dealing with FAIB.
Yeah, absolutely. I personally just didn't realize and thought I was helping a few students that were close.
Sure.
They were like a point or two away is what happened.
And then just another thing that was just raised a red flag for me. It says that you don't have an attendance tracking system. That's really important because, as you know, students are required to meet a certain number of clinical and theory hours to sit for licensure. So we have to know what hours they've done and when they were absent. Has that been corrected?
Yes, I think we have a very small program.
Yeah.
We don't admit more than 20 students, and we are very strict about attendance. And so the reality really is that we've always known when someone was absent, and we required them to make up the time. And it's so rare that I think we just neglected to have the paperwork to track it.
Sure.
A very easy thing, and we've already corrected it.
So the hours that are being reported to the board that they've completed are accurate, correct?
Yes, the hours
Absolutely.
that we report are correct, but we haven't been
Got it.
clerically
Right. Sounds like you're taking care
confident.
of it.
Yeah, we can
Thank you.
fix that easily. We did already.
Thank you.
Any other comments or questions for this school? Seeing none. Paula?
And this might be inappropriate, council, please tell me if it is. We hardly ever, or I'm new to the board, and so this is the first time I have a community college here. And just quick question, can you just briefly, can they give like a brief, like how they do admissions? And because I'm not aware that, is this out of scope?
The way this has been agendized is for potential action on the recommendation. And if the scope of the question exceeds what is
It does.
included on the agenda, then it would be inappropriate to have that discussion. It'd have to be agendized for a future board meeting.
Okay, no problem. Thank you, though.
Any other questions or comments for the school? Seeing none. Bernice?
I move that we accept the report and recommendation from Faye Silverman.
I'll second.
So it was moved by Bernice and seconded by John to accept the NEC's report and recommendation. Do board members need any more discussion on it? Seeing none, is there any public comment? Seeing none, we'll do a roll call vote. Paul?
Yes.
John?
Yes.
Bernice? Oh, I missed Paula.
Yes.
Sorry. Bernice?
Yes.
I'm a yes. Ken?
Yes.
Samantha?
Yes.
Alita?
Yes.
Cheryl?
Yes.
Okay, motion carries. Thank you.
Thank you very much.
Thank you.
Okay. We are on 15B2 Mission College PT program. If we could have, thank you, Margarita. Thank you, Margarita, for the report. Do any board members, we've received it and reviewed it, do any board members have any questions regarding the report from the NEC? Seeing none, is there a representative from Mission College present? And if we could have you state your name and your title and whether or not you agree with the NEC's recommendation.
My name is Marsha Oliver. I'm the director of the Psychiatric program at Mission College, and I accept the NEC's recommendation.
Thank you. Do any board members have questions for this school? Seeing none, do we have a motion?
Can I
I'll
just?
make,
Oh, Ken?
I just wanted to say that our violation, our problem is with the pass rate. So when this last cohort was taking their exams, and then as we got the results back, I was a little surprised. So I followed up with the students. 4 of the 13 that failed, I contacted them and asked, because I wanted to find out, is it content information they're not getting? How did they feel? All 4 of the ones who failed were ESL students, and some of their issues were being able to understand and comprehend the questioning. So I'm currently working with ESL at our college to try to help me learn more how to help them. I currently have 3 ESL students in the cohort that is now in, that will graduate in May. They seem to be doing okay, but I'm still working on that. Also, in looking at the reports, it seems that behavior modification continues to be one of our struggling areas for the students. So I have contacted and reached out to the other PT directors, and right now I'm working with Robert Millay from Napa and Marianne from San Bernardino to see what we may be lacking in our curriculum, and trying to improve on our behavior mod, and doing that so that hopefully will help with that too. We have one student who has not taken the test from this last cohort. I contacted her. She's scheduled for December 27th. Her rationale is that she's still studying and preparing. She's currently working as a pre-licensure psych tech at Stockton. So I've asked her if there are things that I could do to help her in terms of being prepared. And I'm hoping to get more response from her as to what she's doing in terms of preparing. Unfortunately, she is the 5th ESL student. So I'm trying to work with her on that part of it too, so that hopefully she will not struggle with the questions.
Madam President, I just have a question.
Samantha?
I thank you for working with your ESL students. Student success is part of our responsibility as educators. And if that's the need that they have, we know Southern California, we work in a very diverse population, and we need a diverse workforce. Patient outcomes improve when we have a diverse workforce, and our VNs and our PTs are of diverse origins. So I would encourage you to do everything you can to support your ESL students, and it sounds like you're doing that. I noticed in July to September of 2018, you had no candidates tested. When do we have any test results next quarter?
The only one that I'm aware of is the one that has not tested, and she is scheduled for December. So that would be all of the 13 that have taken the test
So then,
from the last cohort.
Next quarter, you only have 1 test. So your pass rate will either be 100 or 0.
Or 0, yes. So unfortunately, because we take in every 18 months, we complete a whole cohort. So this cohort that I have in right now is 12. They will be graduating in May, but they will not be testing until summertime.
So it's going to be a while before we get Margarita right.
Yeah.
That's one of the reasons that after meeting with her and talking, she has put in a request to admit to replace the May class, but not until next August. So I said that will give an opportunity. Let's extend your provisional to see what happens with this May class, and then in August, when she asked me for which she already has, the August class, we may have some results from that May class. If not, then we'll address the concerns and the issues at that time, moving forward.
Right. The problem is that we've with our combined programs, we'll be taking in our VN and Psych Tech cohort in August for the new group. If I can't take in at that time, then it'll be another year and a half before we can take in a group.
And I'm also glad to hear that you're working on enhancing your instruction around behavior modification, because we know as psych techs, I think Paul would agree, behavior modification is one of the largest duties or greatest duties of a psych tech. So
I'm also working on trying to get Morgan Autism Center to allow us to come in. We used to have a chief kids, but it was disruptive for their children, their students.
do you have a developmental disabilities facility that you use for
Yeah,
clinical?
we actually have 3 different ones, yeah.
Okay,
But
thank you.
the one Morgan is more behavior mod, yeah.
Thank you.
Any other board members have questions or comments for the school? Seeing none, can we have a motion?
To accept the NEC's report and recommendation.
I'll second.
So it's been moved by Samantha, seconded by John, to accept the NEC's report and recommendation. We will do any further discussion needed by the board? Seeing none, any public comment? Seeing none, we'll do a roll call vote. Paul?
Yes.
John?
Yes.
Paula is absent. Bernice?
Yes.
I'm a yes. Ken?
Yes.
Samantha?
Yes.
Alita?
Yes.
Cheryl?
Yes.
Motion carries. Thank you.
Thank you.
We will move on to 15C, request to admit students by programs on provisional approval. We're going to start with 15C1, Angelus Institute. Beth DeYoung, thank you. We've received the report and recommendation. Do board members have any questions for the NEC? Seeing none, is there a representative from Angelus School present? If you could state your name and your professional title and whether or not you agree with the NEC's recommendation.
Brandy Cower, Director of Nursing, I agree.
Do any board members have questions for the school? Seeing none, could we have a motion?
I move that we accept the report and recommendation of the NEC.
I'll second.
We have a motion and a second to accept the NEC's report and recommendation. Is there further discussion needed by the board? Seeing none, is there any public comment? Seeing none, we'll do a roll call vote. Paul?
Yes.
John?
Yes.
Paula?
Yes.
Bernice?
Yes.
I'm a yes. Ken?
Yes.
Samantha?
Yes.
Alita?
Yes.
Cheryl?
Yes.
Motion carries. Thank you.
Thank you.
And we will move on to 15C2, Institute of Technology, Clovis. If we could have Margarita Valdez back up.
This is one of our babies. We work closely with the director. I think you're all familiar with.
Thank you, Margarita. We've received your report and reviewed it. Do any board members have questions for the NEC?
Before I start, there's 2 corrections on it. They were put on provisional status August of 2018, not May. The campus in Modesto was put on in May. And in addition, in the data for the licensing, the April to June. Oh, in April to June, the April to June, it was 13 students that took the exam and 10 passed. They're in the wrong columns. Okay?
Okay. Do board members have questions for Margarita? Seeing none. Is there a representative from Institute of Technology? Oh, Paula?
Could you just repeat what the second correction was, please? The first one, sorry.
The first one was that they were put on provisional initially in August of 2018, not May.
Hi. You're the representative from Institute of Technology. If we could have you state your name and your professional title and whether or not you agree with the recommendations.
I'm Paula Richards, Director of Nursing for Institute of Technology, Clovis, and also Modesto campus.
Thank you. Do board members have?
I agree.
Sorry. Do board members have any questions for the school?
Good morning. It's also maybe a question for Ms. Valdez. This school has been on provisional for 1 year, correct? 2 years?
No, just now. They started August of 2018 is the first time they were put on provisional.
Oh, I see. That was your.
That's where the confusion.
That was your first, okay.
Yes.
So you've only been on provisional for 6 months?
Not quite. 6 months will be in February.
Okay.
August.
Because what I was going to ask you about was the pass rates, which are abysmally low. You had one good quarter in 2018, and then they went back down.
The good results in 2018 resulted from a class that had some of our improvements in their program, the curriculum changes, and they had a 3-day live review and those kinds of things. That quarter, the students who graduated and actually took the test in that quarter are the ones that passed, and we got the good rates. The next quarter were the ones that had graduated with the same group in April, but they didn't take their test until July, August.
So it's the same group. One took their test
The
right away
same
and the other
class.
waited. Same class.
And I just want you to know, I know you can't do that, but the class that we had that graduated in August, so the October, December, they're taking their test. 16 of the students have taken their test, and 16 of the students have passed that exam. All the rest of that cohort is scheduled to take their exam in November. As
How many students are left to take from that group?
16 out of 25.
So there's 9 left to then take. So we know that, and the evidence backs this up, the sooner students take their test after they graduate, the better chance they have of passing. I mean, that's borne out through research and experience and everything. What steps is your school taking to encourage students and support students in taking their tests right away?
We've started with, I've always encouraged them to take their tests right away, but now I'm providing each of the classes, besides just the scientific data that states you do better if you take it quicker, and besides telling them, the longer you go, the more you will forget. Now we've actually instituted with ATI and tell them that within 90 days of graduation, if they want us to pay for their exam, they have to do it within 90 days of graduation. And it's helping us that we now have statistics and they know their classmates, and we're able to say, look, X number that took the test right away within the first 2 months of graduation, look at these all passed, these didn't. I think that's one of the reasons why with our August graduates that they're taking the board right away. And I keep track of them, and I follow up with those that haven't stepped forward and got their paperwork. What's the holdup? What can I do? How can I help you? And follow through with them.
I'm glad to hear you're being proactive in that sense.
I
kind of have to be in this situation.
I did want to say that on her behalf. She is continuously, because we communicate before I wrote this, and she sent me information and data. She is following and tracking every student. She has put those things in place, and that, based on that, was where I recommended that they approve an additional course so that she can continue, and there be gathering more data also as to the changes.
Great,
And I did want to comment to the board that the improvements that you all agreed to so that I could start my August class, I want to let you know that the change in the entrance exam to the HESI A2 predictor, anecdotally, all of my instructors and myself, the campus president, all of us involved in the vocational nursing program have noticed a marked improvement in the motivation of the students, in their ability. They come early, they're studying, they don't just goof off, they're always studying out in the atrium, even at breaks. They stay after class even when they don't have makeup hours. I mean, that's really different. And their grades as a whole, the class average is much higher with the predictor exam.
Sounds like some good things happening.
Right, and this, the August class is the first one that will have the full benefits of all of the improvements. They started ATI, introduced into the curriculum on day one.
Any other board members have questions or comments for the school?
Just an observation, you were with us before and you brought your president. And so it is clear, well, he didn't come down to sit with you, so we.
I invited him, but you
Yeah,
know,
that's
he's
fine.
not wearing a tie today, so.
My comment is it's clear that you have administrative and other support. And it makes a difference in the success of the students. And that's what we're really concerned about. And my colleague was able to point that out based on what you're doing and in the questioning she had for you.
I very much appreciate the support of the whole institution as having both campuses. It's the campus president, the corporate members, the CEO have been extremely supportive in providing me the resources that I need to improve the program. And you're right, it makes a big difference.
Thank you. Any other questions or comments? Seeing none. Ken, do you have something to say?
Madam President, I move that we accept the recommendations of the NEC and the report.
I second that.
To clarify that, is the motion to accept the recommendation in the report as corrected on the record today?
Thank you. I accept the amended format.
So there's a motion on the floor made by Bernice, seconded by Ken, to accept the amended NEC's report and recommendation. Is there further discussion needed by the board? Seeing none, any public comment? Seeing none, we'll do a roll call vote. Paul?
Yes.
John?
Yes.
Paula?
Yes.
Bernice?
Yes.
I'm a yes. Ken?
Yes.
Samantha?
Yes.
Alita?
Yes.
Cheryl?
Yes.
Thank you. Motion carries.
Thank you.
Thank you. And that brings us to Evaluations Committee report and possible actions. Ms. Bernice?
Yes, Madam President. I'm referencing item 16A, and in terms of a summary, I'm highlighting some of the key points. Also, this is a committee that reviewed its purpose as part of our ongoing work around strategic planning. We appreciate the support and commenting support from the EO and staff. Key, there's been some updates and certainly advanced to our advantage, change in processing times around evaluations and the handling of other documents related to the public, but particularly to our constituency groups. We want to compliment, as an observation, so many of the schools who are currently using the cloud drive to upload school information. It has enabled staff to increase the response to schools and thereby getting documentation and license information handled in a shorter time. And there are other elements, but those are key to what we want to draw the board's attention to, unless you have other questions.
Any board members have any questions for the Evaluations Committee? Paula?
I see on the report that 62 schools are participating on the cloud drive. Do we have a number of those who are not, or?
Well, we have about 150-something schools.
Okay. Thank you.
Thank you. Thank you for the report. We'll move on to Licensing Committee. Paul?
Yes. Hi, good afternoon. We did meet on November 1st. It was attended by myself, the chair of the subcommittee, Ms. Amazola Dehara, our public board member, our executive officer, Elaine Yamaguchi was participated, counsel, Mr. Swenson, and the licensing program manager, Jen Johnson, was in attendance. We had an update on staffing. We have a supervising program technician was hired and started on 10/22. We've had a staff service analyst reclassification was approved, and they were at the time conducting, or they had conducted interviews, and then they had an OT reclassified to a program technician, and that was approved, and they were in the process of interviewing and hiring, and those folks started already. There was a discussion about we have cash that has been a part of the fine systems, and we've had some difficulty in collecting. There was an update on the process. Do you want to make any comments, Mr. Swenson, on that?
Thank you, Mr. Seller. So I've been asked to meet with the probation manager to review the probation intake process to see if there are additional steps that could be taken to enhance the collection of the costs that are awarded, and I'll be making a report to the committee with possible recommendations of what steps could be taken to enhance that process in the future.
Thank you. We got an update from Ms. Johnson on some of the reclassifications. I believe I just covered that. And a change in reporting. The licensing service unit will report to the licensing and evaluation instead of the administrative support services. We had a review of the license division performance measures, and are you going to cover that? Please. Yeah, if you'd like, go right ahead. I'm sorry. I'm going to have Ms. Lyman cover the data. She's more intimately involved with it.
Good morning, and thank you. And I appreciate, Paul, you deferring that to me because there's a lot of numbers.
Yeah,
and
a lot of numbers.
and I know what the numbers speak. We've had some comments from our board members. In fact, Ms. Norton at our last board meeting had asked if we could start tracking certain things, if we could make the board aware of those statistics. One of the things that she had asked for was the number of incoming faxes that we receive at the board. We started to look at the incoming faxes and realized that the incoming fax material is actually subsequent information. It's deficiencies. People are faxing into deficiencies. So if we started counting that, then we're going to give you false numbers on what they're actually doing because these are deficiencies. A couple of items that we did add name changes and address changes, and I do believe you have that information in your packet. This gives you a good idea of things that are touched by the board by the board staff. So in 2017, they received 413 name changes, and up until October of 2018, they processed 275. When we look at address changes, some of these applicants cannot do address changes in Breeze, but licensees can make those changes in Breeze. But the ones that we had to do in-house in 2017, they processed over 14,037. And so far up to October of 2018, they've processed 8,861. And that's in addition to answering the phones and responding to the faxes. And the next statistic is the incoming emails. So in 2017, they responded to 19,636 emails. And as of October, I only have a stat until September, so up to September of 2018, they've already responded to 14,425. When we look at the number of applicants and licensees that come actually to BVNPT into our fabulous looking lobby, in 2017, they had 5,109 visitors. And up until August of 2018, we had 2,495. When they come to the front counter, the issues that the front counter staff are dealing with are license renewals. So at the end of the month, we see a lot of visitors. For license renewals, they come in for name changes, address changes. And the next one I'm going to talk about is the temporary licenses issued at the BVNPT front counter. In 2017, we did not keep stats for January through March, so between April and December of 2017, 306 people visited BVNPT and asked for a temporary license. In January 2018, up until September, we had 368. I want to point out that in September, nobody came to our front counter and wanted a temporary license. The credit goes to our entire licensing division team because that means they are not running backlogs. They are processing the information from the schools, the online, and the in-house. They're getting the work done. So the people don't have to come to our front counter and ask for those temporary licenses. We get a lot of phone calls at BVNPT. In 2017, we had 252,207 incoming telephone calls. In 2018 up until September, we had 181,390. You realize that we're actually not answering all these phone calls. We have 5 people at our reception staff that were answering the calls, and we're having problems doing that. So the next statistics are the ones that the number of calls that we're actually answering. So in 2017, of those 252,207 calls, we actually answered 28,672. When we look at the number of calls that we answered for 2018 through September, we've answered 18,266 of those 181,390 calls. So we're answering 1% of the phone calls that are coming into BVNPT. When you look at certain months, when you look at March of 2018, there were 32,723 calls that were coming in, and we only answered 1,913. When we look at some of these statistics, we think of what was going on in March. Well, I know for a fact that our fax machine was broken when I came in. I know that the computer in the lobby wasn't working. There's a lot of things that weren't working in March of 2018, and we had a lot of phone calls coming in. As our team started to jump on the backlog, the number of calls are starting to go down, because in March, when we had over 32,000 calls, you look at the next month, we only had 18,723. That's an incredible amount of phone calls coming into our board. If you've tried to call, you're frustrated, and I understand that. So the reason why we're doing the licensing reorganization that Elaine's talked about, that Paul and Paula have talked about in your committee meetings, is due to the fact that we need to get more people on the phones. We need to make sure that we're keeping up with the backlog. We need to make sure that when people have a name change or an address change that they actually send into the board, that those are getting processed so they don't keep calling us to say, hey, did you get that done yet? So that's a lot of the reasons behind these statistics. The other ones, Paul, then I'll just talk to briefly, and Bertie's hit on that too, is that because our team is doing such a good job, we're not seeing a lot of backlogs. So as far as our both PT and VN, our school applications in-house and online, we're within 2 weeks of getting those applications processed. The equivalency applications, those are always going to be a challenge because our staff service analysts, they really have to look at those because you're determining somebody's ability to perform as a licensed vocational nurse based on a piece of paper that they're giving you on the college transcripts, and they need to make sure that consumer protection is number one, and that when they evaluate those, that they are making sure that they have everything checked off, that they are going to be a good qualified candidate. So they take a lot of time, and we're glad that they do. So when we run that backlog, it's not a backlog. It's a good backlog because we want to know that they're doing the best job, and we've got 4 people doing it. So any other questions on any of these stats that we've presented to you?
I have a question.
Yes.
On the incoming phone calls, I mean, that's been an ongoing issue. It was an issue before you guys came on board. But I just want to correct one thing. I think you said we're only answering 1% of our phone calls. But if I'm looking at the numbers right, I think that's actually 10%.
Okay, good, thanks.
18,000 of 181,000.
Okay, good.
So it's still terrible, right? 10%
Which
is
made
still
me feel better,
terrible.
thank you.
But it's a little better than 1.
Yeah, thank you. Bad math,
But
sorry.
it's an ongoing issue. It was an issue before you guys came on board, obviously. But we know that 10% of answered calls is not acceptable.
Correct.
I mean, we know as from a customer service perspective and protection of the public, because who knows what these people are calling in for, that we have to do better. We must. We just have to do better. What is the plan? What is the, what steps are being taken? We talked about getting more people on the phones. Is there anything else going on? I mean, what is do we have a specific plan? Or?
We have a plan. We have a fabulous plan. We just need people to fulfill our plan, and that's what we're trying to do.
I see.
In the beginning, we had 5 people. We called them the reception staff. Today, as of today at 3:30, only 1 of the original 5 people will be actually at BVNPT. The other have gone to, they've had promotional opportunities. So we're starting with a brand new crew. What we're doing is we've talked about this, where we're changing the duty statements to program technicians, and we're putting the people that were at the front counter, we're adding them into the mix. They're going to learn how to do evaluations and endorsements. The people that are doing evaluation and endorsements are also going to be on the phones.
They're cross-trained.
Everybody's being cross-trained, because one of the things we found when we got to BVNPT is we had silos. And you had one person that only did one thing. So if that person was gone for a nice 3-week vacation, nobody touched anything on their desk. So that was of great concern to us. So the cross-training has begun. The other really incredible thing that we're doing is, Elaine had mentioned it earlier, is with our organizational change management team, is they're actually mapping our processes. They haven't hit our front counter yet because we've had such turnover right now. We're building the team. Jen is holding interviews on the 26th, and we also have another job announcement out there. So Jen and her new supervisor have been very proactive about getting the interviews done. They have interviews back-to-back for 8 hours, and then we rush things through OHR as much as we can. So we do have a plan. We're trying to execute it, and unfortunately, we're taking baby steps because the people that weren't really answering the phones know how to answer the phones, but we just haven't put them into that mix just yet. So we're starting slowly. We have some great cross-training in. I apologize, I was looking at my email, and the person that we hired that started on Halloween cleared out the phone queue last night in 15 minutes. So she came from DMV, so she's a veteran of customer service. She's fabulous. And she's on it, and she's had some great training by Demery, and they're doing a great job. So we've got to do more of get that going, and I appreciate the question.
And I thank you for your efforts. And like I
trying.
said, it was a problem before you came, but thank you for your efforts in making it a priority.
I'll work on my math, I promise.
Hi, Vicki. Thank you so much for telling us the numbers and kind of clarifying the voids and where we see zeros and when we see blanks. I think that's really good to clarify those empty cells. And as part of the plan, and this is something that just came to mind because we know that that we're going to be having a YouTube channel, and we now have webinar systems, and I think it would be good to think about how we can do like a Q&A with licensing and be digital, be on the YouTube. In the future, we can also think about having and I don't know how difficult this would be with IT, but having a chat box where some people who, get on the chat for an hour and answer questions that come through the website. And I think that if we start answering questions outside the phones, we will get less phone calls. Because I think, if we have 150 licensees and we're getting 252,000 calls, that means that there's a void in communication. It's almost like every licensee is calling it twice. And that's a problem. That's a communication problem. And so we want to communicate with our licensees at in the many platforms that we are have touch points with them. So if we have a website, then we have a chat box where they can put questions, and then once a day, one person goes on there, answers questions. If we have the YouTube channel, then have a Q&A webinar type of, these are the most common answer questions. If now you have that beautiful screen on your, we can also roll it through there. I really think that it's about communication, the problem. And I hope that you can incorporate a communication. I think that the plan about increasing the staff is a great plan. I encourage us to be thinking about how to have other touch points.
One of the other things that we decided to do is look at our website, because we could refer the people that are calling into the website. So we have to up our game with our website. So we've already assigned one of our managers to get a team, start looking at the website. We've talked to enforcement about looking at their side of the website also, where we need to have a very comprehensive website. When we talk about the cross-training, Jen did a little experience, and she kind of listened in on some of the phone calls, and she found some gaps in training. So what that means is that we have to up our game and train the people that are actually answering the phones to make sure that we have that one and done, and that's really important to us. So with Jen working, we've got a new supervisor, Leanna, that's fabulous. They're going to be going around and helping our team up our game. And again, from what you've seen and what we see in the statistics, we need to do that.
Mm-hmm.
So thank you for your comments, Paul. I really appreciate that.
Yeah, great job. I just want to say.
Hi, Vicki. Thank you also for the report. And continuing that conversation around technology, are all the staff issued a government cell phone?
No, I forget which governor took all the cell phones away from this one. Governor Brown took away state cell phones to anybody below a manager or two. Okay.
Well, knowing that we have a new governor that's coming in, he may be inclined to change that rule. But in the case that it's not, I still think that we should look at some technology that's through phones and text messaging, because I think that the millennial population is truly not a phone. I'm surprised that the number is so high, because talking over the phone is not typically the culture. And so if there's a way that we can invest in the text messaging so we can instantly reply back, similar to the box theory, I think that could also be another answer to the high number.
I think that it's the instant messaging is what you're right. The challenge that we have is the system, the Verizon system that we have now is a little outdated. So we're trying to see about upping our game as far as the technology we actually can get in the future, and that's going to cost some money. But it's something great to look into. And you're right, our licensing population, our younger licensing population, that's the method that they'd rather do. They're doing this and not this. So I absolutely understand what you're saying. Thank you.
I'd like to comment too. While the call volume and percentage answering is the white elephant in the room, and I do ask every time, where are we with the call center, if you will, or the increase. And looking at these numbers now over the last year, there are significant decreases in, for instance, the processing times as we go digital and we get those online, which is freeing up resources for these other needs, and again, the cross-training that's taking place. I also wanted to point out, I know that number is significant, not making apologies for it, but I think also these are, correct me if I'm wrong, these are absolute numbers. So you call in, you get a busy signal, or you get put on hold, you wait 10 minutes, you get mad, you hang up, you call back 5 minutes later, you're now a second call and a third call. So some of these numbers are the same folks recalling or getting frustrated and coming back. So yes, they are large, and no, we're not done yet, but there definitely is movement in the right direction among all of the data sets and times. So we'll keep you informed.
The other thing that we're trying to do to up our game, and I had some really good feedback from our executive committee a few weeks ago, is when we look at the processing time, the one thing that we're not looking at is actually how much work was processed during that time. So we've actually created a database that we're moving to, where when the work is assigned, you'll know exactly who's getting the work, the day it was assigned, and the day it comes back, and how many documents or pieces of, how many things were assigned to the individuals. So when we come back in February, I think we're going to have a really robust group of statistics. It may put some of you to sleep, but some of you might go, wow. And I want the wow factor, because I want you to realize that there's a lot going on at the board. We've got, at some point, I'll tell you exactly how many people we have doing how many processes. And I think you'll be amazed and thankful, like Elaine and I are, for the work that they're doing. They are nailing it, and they've got a great attitude. And I'm fixing them lunch every day next week, because we got a lot of people out, and we got to get those phones answered. So we're going to do what we can to keep them happy and keep them working.
Thank you.
You go for it.
Okay. One of the things that we discussed just briefly was, over the past month or so, Vicki and the NECs and the Educational Division sent out a survey to all the program directors, all the schools, and asked them if they could give us an estimate of in which month how many people would graduate. And we've got probably more than half, probably like, I would think about 5/8 of the schools have responded so far. And actually, no, more like 3/4 of them have responded so far. So we've got these really interesting numbers now that throughout the year, so month to month, we show how many people we think will graduate, which is going to impact the phones, the emails, the applications for taking the test, and the applications for licensure. So with this in mind, we're able to, I think, look again at our statistics and start doing a little bit more creative planning in terms of our staffing. One of the things that Vicki didn't mention, just in terms of of how we are kind of adapting our staffing on the phones and everything, is we all know that our licensees and members of the public do a lot of this business over their lunch hours. But we've always had the same amount of staff, the same number of staff there from 8 to 5, because we've only had those 5 people. And we do have to allow them to take a little bit of a break. Otherwise, they may go crazy. But with increasing the total pool of people who are doing this work, we're able to, I think, fluctuate a little bit. We're able to stack it so that from 11 to 1, we might have a couple more people on the line. And, at 8 in the morning, 8 to 9 or so, when nobody's quite awake yet, we may have fewer. But as we go forward, as we continue to have more and better information, we're going to be able to do more and better planning and more and better predictions. And that and our work with OCM and all the other things we're working on. 2019 is going to be a hard year. We're going to be doing a lot, and it's not going to be easily seen, but I do believe that by the time we're preparing our Sunset Review report, which is probably going to be, summer next year, we're going to have a lot to show, I think, for the last year and a half, that we've managed to take a big bite out of the lags, the backlogs. And so it is interesting, and it's probably only really interesting to the real nerdy among us, but all the same, there's a lot of really great progress being made.
Okay, thanks.
Do you have more? Because I still have to do the division report.
I'll go ahead and finish, then I'll have Ms. Yamaguchi comment briefly, or do you want to do that quickly since you were already going? So we did also get an update. Let me just cover a couple more things and then I'll be done. We did have an update on the strategic planning, which continued Wednesday when we met as a board. That was already touched on. We got some information from Ms. Yamaguchi about the Office of Change Management, and I'll let her explain what she told us then.
Thank you. Yes, as I mentioned earlier this morning, we do have this project moving quite well through our board. The Organizational Change Management Office has been meeting with all of our staff in teams and individually to really look intensely all of our business functions. They started with licensing and evaluation and have gotten to the point where they're able to map out every distinct business process that goes into the overall function of how people get their licenses, how people are able to take the test, how people become a PT or an LVN. That's been moving really well, and they're at the point where they have these maps that they're developing. They look like blueprints, somewhere between blueprints and the Visio flowcharts, but they'll show each step, each individual piece of this. And so then the tricky part and the really exciting part is that then the next step is that they look at each of those steps critically and say, is this something that absolutely has to happen, or is this something that's been done because this is the way we've always been doing it? And in that way, we're going to be able to, I think, make a lot more efficiencies in our processes. So as I said this morning, it's going to be a long process. We're not going to see, this jump overnight or this rapid decrease in processing time overnight. But overall, between now and I would say mid-late spring, we're going to be seeing, I think, a lot of really quality analysis and of our processes that are going to make, Vicki and I have a much better information to make decisions and recommendations that we're going to be able to share with the board. So, like I said, this is great progress, and I think but to actually to do this backwards, one of the things that I know we talked about in the committee, and actually several of the committees, is not just strategic planning in the process that we're in for our future strategic plan, but also going back to the existing strategic plan, and I think evaluating and analyzing the work that has been done in response to that plan, mapping out, I think, where we've been quite successful and where we've got some work left to do. Remember, that strategic plan technically carries us through 2019, but it's also, it's a very important document for just on the face of it, but it's also, it behooves us to really look very critically at that document and our progress and our plans for the coming year with that document, just as it kind of leads into the next strategic plan, the one we're working on right now. Because there are going to be goals that are ongoing, and there are going to be things that we didn't have the time or the bandwidth to do because of, say, for example, board or staff transitions. So it's going to be a long process, but strategic planning should always be an ongoing process. Not to dismay you, because I know that the general tendency, of course, is always to say, when are we going to be done with this? When do we get to move ahead and actually do these great things that we're talking about and planning? We're going to do both. We're going to plan and we're going to act on those plans simultaneously going forward.
Thank you very much. The last item I'm going to cover real fast was we did have a discussion, a continued discussion. It was brought up at the last meeting the board addressing substance abuse awareness. We were very pleased with the positive response we got, and we are continuing to develop a strategy that we can bring forward to the board, and we'll have updates on that hopefully by the next meeting. And then I'll give it back to you. Are you going to continue with data on this topic or going to a new topic?
The division report.
Okay, then in that case, then we adjourn the meeting, and that was pretty much it.
Thank
Thank
you,
you.
Paul. So we'll have Vicki do the, where am I? Licensing division report.
Thank you. I'm not going to repeat some of the things that Paul told us. I will let you know that for the vacancies, we do have one vacancy. Jen is doing the interviews on the 26th, and because we are losing Catherine today, we are going to put out a job announcement as soon as we can. Probably the only other thing that's really important to know about Licensing Services Division is an update on the CE audit program. Again, we used our organizational change management team and actually asked them to take a deep, hard look at how we're doing the CE audit process, because we do not want to fail. We cannot fail. The other thing that Elaine and I did is we developed our CE audit analyst team. Geraldine, Aaron, and Jeff put together an incredible memo to Elaine and I, basically outlining all the resources that are needed to successfully complete a CE audit. They basically told us how much it was going to cost to mail out the letters, how much it's going to cost to buy the paper. They did a great resource evaluation. The one challenging resource evaluation that they showed us was in personnel. Because we are short-staffed right now, we actually wanted to send out the CE audit in November. That was our goal. We had to give them a date of when we're going to start the CE audit so they could work back and make sure that we had the resources in place. Financially, we have the resources in place, but resource-wise, as far as the actual personnel to process the information that comes in on a CE audit isn't in place yet. We talked about the silos that we have in licensing. We actually have one person that does that right now, the only person that does it right now. So if that gentleman goes on vacation, I have nobody to process the CE audit, which in turn could raise the number of phone calls that we get, because people are going to call in and say, hey, did you do my CE audit yet? So these are things that we're looking at. So when we had our OCM team look at it, they did one of their mapping processes. So we're going to be sitting down with them very soon and looking at them. Again, with our cross-training program going on, we're actually going to have the bodies in place to help when the CE audit information comes in. We're also going to set up an email box. So if there are specific questions, we can get them answered in a timely manner. We'll have a group of people that will be able to actually answer those CE audit questions. We'll know whose information came in. We'll know, hopefully, the status of where that information is. Again, we don't want to impact the phone calls, so this is what we're trying to do. If you have any suggestions on other things that we could do to help us with this process, we absolutely welcome them. Our target is hopefully the first of the year, January of 2019, when we can actually start the audit. What we've done also is we looked at the actual letters that went out to the people. The individual that's currently doing, or that was doing the audit, said that he got a lot of phone calls because people said, well, why do I have to do this? How did you pick me? Why am I doing this? So we actually put the BNP code in the letter to tell them exactly why it's required that they do that. So when you tell people exactly why they have to do it, they're less likely to call you and they're more likely to send in the information. So our CE audit team took a really close look at everything surrounding the CE audit to make sure that we didn't fail. So I'm very thankful to our CE audit team and everybody that's been involved in this process. Any questions?
Just a follow-up question. How long are licensees expected to retain evidence of CE compliance?
I believe it's 3 years.
3 years?
4 years,
Our
2
license-
cycles, 4 years.
Okay, right.
So we can go back 2 biennial cycles?
Yes.
For an audit?
Right. So when we audit them, we're going to tell them the exact, on the letter, it's going to tell them the exact audit cycle that we're looking for.
And do we have a provision for online submission of documentation?
We are asking them to either email or fax. The preferred method is email.
All right, thank you.
You're welcome.
So I'm glad to see that there's some progress on this, this issue. So if I'm hearing you correctly, it seems that it has been decided that it's going to be 5% of our population per month.
Correct.
That's what we've decided upon. It sounds reasonable.
Mhm.
And that will go out every month, yes?
Correct.
So 5% per month, every month.
Correct. It's 5% of that renewing population for that period. So when we look at it, it's going to be 200 totals, and the breakdown is 180 LVNs and 20 PTs.
Thank you.
Hi, Vicki, this is great. So you mentioned how can we promote this audit? I think moving forward, maybe not this time, but moving forward, it is important for us to be collecting information in a way that it doesn't impact our staff. And so if we're now going to have, an audit coming in via emails, and we're going to get phone calls because they'll be like, why me? And then we're going to get faxes. I think we need to, as we move into more technology, we need to think about how we can create a license portal so that the licensees, when they're getting their CE units, they can just upload them, on there. And then the audit could be simply done by auditing that system. And I know that we're working on a plan, and we're now getting fully staffed, but it's something that we need to be thinking for the future, because we have limited resources and they have limited time, right? So if they complete their CE unit, give them a portal where they could just automatically upload it.
Absolutely, that's an excellent suggestion. Elaine had a comment on that.
Yeah, one of the things that we've been both discussing and getting solicited for is there are a number of third-party organizations, corporate organizations that are, subcontracting CE audit processes for some groups. And so we've been approached by several organizations, and we've looked at their product and evaluated whether or not it would fit into our work. We haven't found a product yet that we feel like is both powerful enough and flexible enough yet. We think that long range, it's actually really feasible, and it's actually would increase the efficiency tremendously. And just, I think, the points you're raising, because the general concept here is that, one, it's a third party and it's all electronic. The burden goes more onto the CE providers, and so their information is like uploaded through the cloud automatically, and so we actually see the population that's taking IV blood withdrawal or a given program, and how many units that is, and when they took it. There are so many loose ends with the products as they are right now that we chose not to put a big investment of time and resources there yet. But we're certainly interested in continuing to speak with the groups, and I think that this is like an emerging market and an emerging product. I would hazard to bet that in the coming, say, 2 years or so, we will see the products that we've, the organizations we've spoken with, we'll see probably a great deal of advancements in them. But I also think we'll also see a lot more competitive products coming into the marketplace as well. I know that there's a couple of them that have spoken with other boards and with DCA as a whole. As I said, there's nothing in the law or the policy that says we can't do it that way. It's just that we just didn't have the certainty ourselves that those products were ready. They weren't soup yet, if that doesn't date me too badly. But like I said, so we were put into the position that we absolutely had to create a policy and a program and a set of procedures internally. You're right, it's resource heavy, and this is why we couldn't embark in November as we'd originally hoped. We simply don't have the pairs of hands to process it right now. But absolutely, it needs to, because it has to impact a variety of things. There has to be information and input into Breeze. There has to be the ability to send out the letters and who's going to lick those stamps, really? You say 200 letters in a month, and that doesn't sound like a lot, but it actually is. And opening those letters back, putting in the information. And I think Vicki had started to make the point, but sidetracked a bit, is that because we're in the situation where we're changing so many things right now, we chose not to add this to the list of stuff that the people are going to do in this reorganization right away. Again, which is why we chose to move backward in time a little bit. But it also is a fact that, yes, we had one person doing this for the years in which the audit was running successfully. And to do so systematically and to do so with quality results, it takes more than one person, and at the very least, you have to have a qualified backup. The point that we didn't discuss, though, is we also have an ancillary need to continuing ed audit, in that we have never been able to, I think, validate and audit and quality assure the providers themselves. This is where I think we would need to be working with the education division, with the NECs, and with an analyst or two there. And that, of course, it's a large and involved process, but I think as we start putting together a pilot program, to start sending out audit requests in the beginning of the year, we'll learn from each and every one of those months as we process, the responses. So we'll learn, and we'll be refining it along the way. We're certainly going to be, showing our results and our analyses and our requests for guidance and direction to, I think, both the education and the evaluations and licensing committees. And by the way, there was also another loose end in CE auditing, and that has always been, well, what happens if I don't comply? And at this point in time, or rather in prior audits, nothing ever did happen, which is why our CE audit team and several others have also been looking with our enforcement crew to start figuring out the way that we construct an effective system to cite and fine people who are out of compliance. That hasn't been done, at least not well, but it needs to be done.
Just one comment. Thank you for looking into those things. I know there has been some citations issued in the past for not completing CEs, but like you said, maybe not consistently, maybe not very well. Once the CE project is up and running and it's going smoothly, what I would like maybe a licensing committee or CE work group to consider is that we accept, let me back up. If you're an RN and you want to do continuing education units, your continuing education units have to be by a school approved by the BRN. If you're a CNA and you want to do continuing ed, that provider has to be approved by the Department of Public Health, who certifies CNAs. However, with us, if you want to do continuing ed, well, a provider can be approved by BVNPT, or they can be approved by BRN. And why spend the money to get two approvals? So usually they're just approved by BRN. And I have long felt that there was some inappropriateness to that, and that our licensees need to be taking CEUs from someone approved by our board so we can check for appropriateness and also just the quality control, that we allow our CE providers, the units we accept can be provided by someone approved by a different board. It's just either outdated or just kind of inappropriate. So I would suggest that in the future, maybe that's looked at in our policies, and that's something we might need to address.
Okay, we'll have to check regulations and make sure that it's something that we can do, but I wrote it down.
Thank you.
Thank you.
Thank you. Any other comments or questions? Seeing none, thank you, Vicki. We will go on to the practice committee report. Samantha, thank you.
So on September 20th, the practice committee met. We mostly talked about our upcoming meeting the next day with the Respiratory Care Board, and we were shown a preview of the excellent presentation created by Ms. Sue Ellen Clayworth and our own Jessica Gomez, nursing education consultant here in the back. They created an excellent presentation that clearly defined the history and scope of practice of both licensed vocational nurses and licensed psychiatric technicians, included all regulatory and statutes applicable to that scope of practice. And we reviewed that, and then we did have a meeting with the RCB board the next day where they presented a presentation of their scope of practice, and we presented ours. That took up pretty much the whole meeting. We started to almost get into a little bit of discussion, and then we said, nope, it's not the time. And so another meeting has been scheduled for December 14th, in which we'll actually discuss the intricacies and the specific duties of VN's scope of practice. So that follow-up meeting has been scheduled. The only other two things we really talked about, we talked about making sure that culturally congruent care is part of our training of our VNs, because that's something they do in practice. And we also discussed a little bit of the YouTube channel and how that could be used to address scope of practice issues. So those were the things, mostly the things that we talked about. We had the meeting. Another meeting with RCB is scheduled for December 14th.
Any comments or questions? Seeing none, we'll move on to the administrative committee.
Sure. Ms. Turner and I and the rest of the admin committee met on October 6th via teleconference, and we discussed a few things. We discussed the makeup of our committee, maybe having some other members join us, rank and file, and we decided that the committee could invite staff members and our management to take part in discussions as appropriate. We do discuss some confidential things, so it's not always appropriate. We also are continuing to work on our plans and our hope to implement a staff recognition project. And so we're looking at some of the programs used by other boards and seeing if that's something we could, parts of that we could use and what parts we should create ourselves. There was an employee engagement survey that went out in the second half of October. You'll remember this is the 6-month follow-up from the April survey. While we do not publicize the specific responses to the employee engagement survey due to considerations of privacy for our staff and potential identifiers of staff, we really want the survey to be confidential so that staff feel that they can truly express themselves. So we want to make that private. I will give some highlights. We had a good response to the survey. I'm just going to highlight maybe 3 things that were very, maybe the biggest findings, and then 3 points where we still have some areas to work on. Almost everyone responded, indicated that they enjoy and take pride in the work they do and that their duties are clearly defined, which is a big one for us because we want morale to continue to increase. It has increased. We want it to continue. And we want to make sure that those duties are clearly defined so staff know exactly what is expected of us. And I know there have been large efforts on that by our managers and our executive staff. There's a strong feeling that staff have the resources, equipment, and training to do their jobs well. That also goes back to what Ms. Lyman was discussing earlier, new equipment, sort of a freshening up of our board offices. Most importantly, and I think this is probably the biggest take from the survey, is a strong majority agree that the BVNPT work environment and culture has improved over the past 9 months. And that's since we have our new executive team coming on board. So that was, I think, the biggest and most encouraging finding. We have a couple areas that we still need to work on. We know change takes a while. Most of the respondents felt staff is kept well informed about issues and changes, but a few expressed disagreement. So that's something that's continuing to be a work in progress, and both our executive officer and our assistant executive officer actually took that very seriously and immediately began thinking about things they could do to enhance communication at the board. Another thing that is an ongoing issue is some staff express concerns about upward mobility and career advancement. We know that staff get to a certain level at our board, and then they are not forced, but sometimes have to transfer to other boards to really make a career jump to a higher promotion. And that's part of just the way our structure is set up, that it's they get to a certain level and then have to go to another within another government agency to get a significant promotion. But things that we're trying to do to help that is first just encouraging staff development. Encourage them to move on and explore new things and develop internal BVNPT specific training programs. So I know that Vicki and Elaine have worked with Solid. I know that even in the past, Mr. Ken Swenson himself went out and did some trainings at our board. Yes, Madam Vice President. Oh, I thought you were raising your hand. So we're attempting to increase the trainings within and also just encourage staff in their career development. Another thing is, as you know, those of you who have been to our board offices, we're in 2 floors and 3 areas. So there's a lot of enforcement is up on the I guess it would be 3rd floor, and then we have 2 sort of suites on the 2nd floor on either side of the elevator. So staff did feel that our team is sort of split up, and it's true, we're physically split up, and that maybe contributes to a lack of unified team spirit, and we have, there's not a lot we can do about that in the immediate future, because that's how our building is set up, and we have a big staff, and we expanded, and we moved into other areas. There are other things that we can do to try to counteract that, such as the holiday committee and outings with the full team, and encouraging communication and contact between the different departments. So that's what we can do right now. We can't change our building layout, and we can't get a new building right now. So we are aware of that, and that's something that will continue to be worked on. The results of this survey were very valuable to us. We want to know where the staff is at. We want them to communicate confidentially and openly and honestly. And we now have a clearer picture of what's going really well and where improvements have been made, and some areas in which, you know what, we still need to do some work. And Vicki and Elaine and our other management staff are very aware of the areas and are working very proactively, I would say, to address things that the survey results were taken quite seriously and were very valuable to us. We also talked, one thing we're doing in admin committee is the suggestion box that's at the board. We will actually review the suggestions in admin committee. So we actually had 2 suggestions this quarter. One was talking about a better way to recycle paper, which is, we actually agree is a good step. And the other was the staff were asking for a new microwave. So we're accepting donations currently. But those are good suggestions, and we will continue to review the suggestion box in the admin committee. So that was basically what we spoke about, and some highlights from the survey. I don't know, Ms. Turner, if you have anything to add, or Elaine or Vicki, did you want to add anything to that?
No, but thank you very much for your comments.
And that's our report.
Thank you. Do any board members have any comments or questions for the committee?
I just want to say thank you so much for the report. It was very thorough, and I really appreciate the commentary so that we can get some insight on how the staff is feeling. And was there a mention on how the board can contribute to the holiday planning committee, or did I forget that? Elaine.
Yes.
Thank you.
So the staff do actually have their own holiday planning committee where they plan events, even has to do with on-site decorating and events, taco trucks. There was a baseball game. There's been many things and continue to be planned. And as we discussed previously, there will also be a staff holiday party, and there's funds raised through fundraisers by staff, and also board members can contribute to that. You would contact Elaine with that if you're interested.
Thank you. Any other, Ken?
I just want to thank the report, but also say what a difference leadership makes, Vicki and Elaine. So thank you very much.
Thank you. Okay. Jay, is lunch here? So at this time, we'll take a break for lunch, and we'll come back at 1:15. Paula?
Can we do one?
1? Okay. We'll come back at 1. So we'll adjourn for lunch and then be back at 1. Thank you. And resume the board meeting. We left off at agenda item 20 for the Legislation and Regulation Committee. And I will turn it over to Ms. Cheryl.
Thank you very much. The Legislative Regulations Committee met on September 28th, 2018. I'm the chair of the committee currently, along with my colleague who was present, John Deerking. At that meeting, Elaine Yamaguchi, the new enforcement chief, Candace Rainey, and our attorney, Ken Swinson, were present, and staff person, Samantha Kalma, she helped us staff that committee. As I told you last meeting, we are at the end of our legislative time for the legislature. And out of all the bills that we track, 4 of them that relate to the BVNPT, or at least appear to relate to them, were passed. So I'm just going to briefly go over them. The first one is AB 1659 by Assemblymember Chu. That related to those licensees who were going to go inactive. And you heard me question the budget analyst about that potential impact on our board. So that law, which was chapter, will allow boards, not just ours, to change or reduce the fees for those that go inactive. Okay? It also will allow, well, let me rephrase that. It prohibits licensees from representing that they're active when they're not active. So that's a new thing. We did discuss the possible impact if we decided to either eliminate fees for inactives completely, and we were told that it would result in about $115,000 loss per year. But we're not leaning that way so much, but we are looking at the possibility of decreasing those fees. But that's a matter that will be tabled for the future committee sometime next year, and we'll certainly present that to the board, and the board will have the opportunity to vote upon that. The next item that we had all voted upon to take a position on, and the majority was to oppose, was AB 2138 by Chu and Lowe. And that one was to limit the board's discretion to deny or revoke a license based upon a criminal conviction. The governor did eventually sign that into law. And so as we discussed last time, that would prohibit a board, any board, under the DCA basically, from prohibiting the license or denying the license or revoking the license if there is a criminal conviction that is older than 7 years old. Now, there are exceptions if we determine that it is substantially related to the duties, responsibilities, and qualifications of a licensee. But we are instructed by this law to set a criteria to address that, so that there will be a standard that everyone can look to. Also, it relates to expungements. If the expungement is there, then, you know, we can't use that as a basis either for denying or revoking a license.
Does that include that same exception?
I didn't hear you.
Does that include that same exception, that if it was substantially related to the, or does that just blanket if it's expunged?
I believe that if it's expunged, then it doesn't count.
Then you can't apply that standard of, okay.
But we'll have to set the criteria on that. Yeah, that's, well, okay, so serious violent criminal offenses like sex offenders or murders or anything like that are not covered by that. So we can deny based on that no matter the time period, right?
Okay.
Also, if there is a failure to disclose something that is more than 7 years, or that's an expungement where it's not a serious crime, then we cannot deny or revoke a license based on the licensee's failure to disclose that as well. Right? So, DCA, legal, they are working on putting some criteria together and reviewing that for us. And I think Ken had said that he would report back on a timeline for implementation of those. It really doesn't start to become official until 2020, but I guess we may or may not consider it at that time, knowing that the law has been signed into effect. Okay. Does anyone, Elaine or Ken, have any comments on that particular one at this time?
Yes, thank you very much. DCA as a whole and the healing arts boards in particular have been discussing the implementation of this bill. At this point, they're in the very, very preliminary stages of laying out a plan to plan, if you will. Clearly, there's going to be a lot of work in the coming year, year and a half before we are required to be enacting this law. But in the meantime, of course, they've recommended that, yes, boards examine their list of what they consider substantially related. And, you know, for nursing boards like ours, really the question is what crimes are not substantially related to the practice. There's a timeline laid out for the next 18 months of pulling together the information needed for budgetary purposes, for planning purposes, and of course for personnel. We've submitted a fairly detailed but really I think large list of personnel that we were projecting that if A, then B, more in terms of our enforcement analysts. We think this is, if this moves in, certainly we'd need more in our licensing evaluations program. And actually, as it moves forward, if the enactment of this bill in general over the state has this kind of impact, we may well see the need to expand our NECs. There may be need for expansion of the educational programs. So right now, and I shared with the executives the very, very broad and conceptual timeline that the department is looking at. Right now, as I said, they're talking. I know that there's a plan of the healing arts boards coming together for a little bit of a huddle because, I think most of the steps we take are going to be fairly similar. So we would want to be able to work together to make sure that if we must reconstruct a wheel, we don't have 20 different reconstructed wheels. But as Ms. Turner was saying, we do have about a year and a half before this bill is actually implemented. That's going to move very quickly. But in the meantime, as BVNPT works to do more in terms of analyzing our own workflows, our own case management, I think we'll be able to get, I think, a fairly interesting and hopefully fairly accurate idea of, what impact this is really going to have. Because remember, at this point, while we're pretty certain that there would be some people who had already gone through a PT or an LVN program who might be reapplying based on this law, I think for the most part, the people impacted by this bill have not gone through a training program yet. So based on that, the degree to which this impacts the need for the nursing programs and PT programs, we have no idea just yet. So it's going to be an ongoing story. But because we think that most of the impacted population will be folks who need to go into the programs, that kind of extends what I think will be the real crunch for our operations, hopefully.
I would add some comments in two areas. First of all, with regard to process, the development of these regulations will require a full rulemaking. So that's why the timeline has been created to promote the board starting on the process early. And then the Legal Affairs Division, in connection with various healing arts boards, is endeavoring to come up with a uniform, or as much as possible uniform approach to the regulatory language so there's consistency. And so the working groups are being formed to do that process. And hopefully if there's consistency in the language, it will facilitate the approval of this board's proposed regulatory language if it's consistent with what other boards are doing in the healing arts.
And actually, I forgot one very important factor. Obviously, one of the most expensive and time-consuming changes that will need to be worked on in the coming year will be updating Breeze to accommodate this law.
I didn't mention another attendee who I see in the audience, Mr. Matsumoto, retired annuitant. No one ever explained what that title meant to me, but anyway, he's present in the audience. All right. The next bill that we addressed was SB 1480, and that one is the fee bill, which we're very relieved that that was signed into law. And the legislature, they gave us a range in which we could increase the fees. At this point in time, we chose to set the fees at the lower end. Our website has already been updated with the new fees. And so as you heard, the budget analyst talked about how that'll make a real difference, and they've already included the estimated renewal income in our budget, future budget going forward. So that was a really great success for us. Unfortunately, we weren't able to reach an agreement with the legislature on the school fees yet. That's still in the works, we hope, or at least we're looking for an author for that. There was outreach done with stakeholders for their feedback. Obviously, you know, they're opposed to that, but they did get some suggestions, and they're, you know, want to remain involved with focus groups and giving feedback on that issue. And that's something that we will look forward to in the coming year or so. Right. And I think that Ken also addressed the process for that when he talked about Section 100.
Yeah, the thought is at this point that we'll be able to proceed with amending the regulations through the simplified Section 100 process. If for some reason that is not approved by the Office of Administrative Law, then a full rulemaking would be required. But it's anticipated at this time that the Section 100 procedure should allow us to implement this type of change.
And the last one was Senate Bill 1003 by Senator Roth, and that related to respiratory care. And then initially we thought that it would greatly impact our licensees with the BVNPT and might somehow restrict their area of practice, but then we learned that it really doesn't impact us so much, and so, but that one did pass. Any questions about those before I go on to our next? Okay. All right, so we also worked on portions of the strategic plan that relates to the Legislative Regulations Committee, and we had some proposed language there, and it was mostly to working with the EO or the assistant EO to come up with, based on what the committee or the board recommended, to create letters of support or opposition based on how we voted, to arrange for testimony at hearings, and to engage in discussions with staff if needed, legislative staff if needed. Okay? And that if there is an emergency, for example, as there was an emergency in 1229 that affected Sunset, that, you know, we can go ahead and act quickly if it was in between board meetings, which the board already gave us authority to do that, and then we would report back to the board for ratification of our acts. Okay. Anything anyone wants to add or have questions about that? Nope. Okay. All right, the regulations. One of the things that we've been working on, I think since last year, was the discussion of school pass rates. Mm-hmm. And so again, we are working on updating our regulations so that we are now working on requiring 75% passage rate of the new class, and we're not working so much on timelines at this point in time. And so in your package, you'll see the exact language that we're working on for that. And then, of course, we'll apply to PTs as well. Yes? I didn't need help with the answer, but all right.
I agree with you. That's something we've been discussing for quite a while, and this board has talked about making this change and have actually approved of making this change. There's been a lot of stakeholder outreach to schools, to associations, to many, many different types of stakeholders. We've heard the feedback. We've all discussed it. We've done our due diligence. How do we now move it forward? Like how can we, I think it's time, in my opinion, it's time that we take some action. Is this something that would be, we would need an author for, that would need to go through the whole process, the rulemaking process?
Well, this is, just briefly, regulations, remember, we can change.
Okay.
But it does require a procedure. It's
Okay.
not a legislative issue. But Ms. Yamaguchi, go ahead, or Mr. Swenson, go ahead and into more detail about the process.
Thank you. To answer your question exactly, what will do is engage in the formal rulemaking process, which means we will be promulgating this language that's in the packet with regard to the 75% pass rate. Just as a footnote, and I think the board are all abundantly aware that 75% of the overall pass rate is still at about the 50th the 50th rank in the national pass rates. This brings us up, in fact, rather to the 50th point. Still a lot of room to proceed. But what happens, actually, the official rulemaking process, actually, I think I'd probably defer to Mr. Swenson on the steps, or just the broad steps.
Sure, I guess what I'm asking is, can you explain to me practically how this will look? So I see a attachment here, and we have some language. I see it. So we've prepared the language for the regulations. Then what is the next step and the step after that, all the way to conclusion? What will that look like?
There are essentially 3 phases to the process. The first phase would be for the board to approve the language. Then it would be put into a rulemaking file. The rulemaking file would be reviewed. Any necessary changes that were identified during that review process would have to come back to the board for approval.
Who would review the rulemaking file? Who would review that?
For this type of a rulemaking file, it would be legal affairs, the director, finance, and the agency.
So basically, it'll have to work its way through DCA, for lack of a better.
And agency. And then at some point, if there's a need for a change prior to it being submitted to the Office of Administrative Law, then it would come back before the board. The next step would be preparing the actual rulemaking package for formal approval. And that would involve the same elements that need to be met. Various approvals would have to be obtained, and it would be submitted then to the Office of Administrative Law. Then the formal rulemaking process under the Administrative Procedures Act would come into play. There are periods of notice required. There's a requirement for public comment and public hearing, and that process would play out before before the formal rulemaking package would be approved by the Office of Administrative Law. Once that approval happens, then the rulemaking file would go to the Secretary of State. And so there's essentially 3 parts to the process. The part of the process that the board has the least control over is once it leaves the board and the department and goes to the Office of Administrative Law, then there are a series of timelines and requirements that have to be met. And so it's best practice to have a very polished rulemaking file that goes over to the Office of Administrative Law, because there's less flexibility at that point on what can be done to make any changes, although changes can be made.
I see. So it sounds like there's quite a long journey that we would be undertaking, but it's important that we undertake it. If it's even possible for you to answer this question, about how long does it usually take for all 3 steps to happen?
Unfortunately, the process is very time-consuming, and although changes have been implemented to try to make it go faster, historically, I think that the formal rulemaking process itself takes up to a year.
Oh.
There are changes that have been implemented and are being implemented to help streamline that process. The regulatory process itself has undergone a change management type review, and things have been streamlined. And so we don't really have historical data on how that may have affected the length of time it takes to get formal approval, but it's anticipated it would, generally speaking, be less than the year or so that it has taken historically.
So I guess today we'll vote on approving the language in our packet, yes?
Everyone's ready to vote. We're recommending.
Does that need a motion, or?
Yes, so we're recommending a vote, if the board is ready to vote on this. Hopefully you've all had a chance to review the language. But basically, I believe that the motion would be that the program shall maintain a yearly average minimum pass rate that does not fall below 75% for first-time candidates of the school for that period.
I would so move.
I second that.
Actually, if I may, a question to council. Do you need separate motions considering we're amending both the VN and PT regs?
So do we need to correct it? I mean, I can add.
I don't think separate motions would be required, but the motion should include approval of the language and authorization to move forward with the formal rulemaking.
I so move as indicated by Mr. Swenson.
Well, just a point of clarification, this would be a committee recommendation.
Yeah, okay,
So it wouldn't be, it doesn't need a second because it came from the committee of 2 members. So we just need discussion. Any further discussion needed from the board?
It's more an information piece. We have constituency groups that are very interested in following this. And have we thought about any pathways or ways that we can keep them updated in terms of the progress? And particularly, this is language that will determine implementation. And I believe that is of greatest interest to many of our constituents.
I would recommend that our website be updated to indicate the progress and the tracking of this. I know many schools do check the website for updates, so that's one thing.
Yeah, if I may, one of the things we had discussed at a staff level, of course, is we would, of course, take advantage of the directors' forums as well. We would make sure that we would ask to have a segment of time to discuss that. But as you know, there had been a lot of discussion previously, and it's just that the exact configuration of how we move forward has not been discussed just yet with our constituencies.
Any further discussion?
Thank you.
Thank you. Any further discussion by board members? Seeing none. Any public comment? Seeing none, we'll do a roll call vote. Paul?
Yes.
John?
Yes.
Paula?
Yes.
Bernice?
Yes.
Myself is yes. Ken?
Yes.
Samantha?
Yes.
Alita?
Yes.
Cheryl?
Yes.
Motion carries. So, Cheryl?
Yes, all right, so now I also see a notation in my notes about seeking board approval regarding the fee changes. Well, it looks like they've already been implemented. Does look like?
No, if I may, the next item in your packet, which would be tagged as,
I'm looking at my notes.
and Tim, maybe you can help me out on this. There is proposed regulatory language to amend applicant licensee and provider fees.
Yes.
Is that me? It is me, actually. Sorry about that. But these these changes proposed basically help us to enact SB 1480, our fee changes. So essentially, basically, it enacts our fee policy bill.
Okay, so you want to vote on you'd like a vote on the regulations? Because
Yes,
we've
please.
already implemented, there's a law and we've already put it on the website, so.
The law itself is implemented on the website. It's how to do it that needs to be, I think, clarified in regulations. And if I'm not mistaken, Mr. Swenson, this is one of the things we were looking into a section 100 on.
Yes, and at the committee level, there is a motion to accept the staff recommendation to pursue a section 100 change. And so that was, that carried unanimously, so it comes before the full board, ready to be acted upon. So the motion that was approved in committee was to accept the staff recommendation to pursue a section 100 change to implement the fee regulation, that is SB 1480.
This would change our regs for, this would be the one that does it in our statute for the range?
So the regulations would reflect what's in the statute.
So it's a motion from the Ledge Committee. Is there any, therefore it doesn't require a second. Is there any further discussion needed by board for this, or do board members have any question for the committee? Seeing, Bernice?
I just want to make sure we all understand exactly what we are voting on. It's not retroactive, but technically, we need to approve what's been done on our behalf. Does that make sense to everyone?
Well, okay, so yes, we've done it from the legislative point of view, but our regulations need to be updated, which we're responsible for as a board, to comply with that. And so that's a process, and it should have a board vote.
Thank you.
Any further discussion by board? Seeing none, any public comment? Seeing none, we'll do a roll call vote. Paul?
Yes.
John?
Yes.
Paula?
Yes.
Bernice?
Yes.
I'm a yes. Ken?
Yes.
Samantha?
Yes.
Alita?
Yes.
Cheryl?
Yes.
Motion carried.
All right, the next issue that we discussed is whether or not to delegate authority to the executive officer to handle the default decisions. So when a licensee is in default, fails to respond, there's a series of decisions we make. I think before we reported that most often the board tends to just revoke because they're not there, they're not willing to participate in the process or defend, but you should know that you do have options other than that. You don't necessarily have to adopt to revocate. You can decide if someone should have probation, but typically they should agree to be involved in probation. So there was a discussion also that was brought to our attention about the board having addressed the issue or possibly having voted on the issue in the past. And so Samantha was there at the time. I'm sure maybe Tammy was there and Mr. Dirkeen was there. And so we had to go back to some old board meeting minutes to find out whether or not that had actually happened. So Ms. Yamaguchi did provide us some research outlining where we could look to, and we were going to table it, but I will say that I did have an opportunity to take a look at it, and it does appear that some votes were made on it to approve the EO taking over that area. I know many of the board members were not there. I guess technically they're still bound by an old vote. So anyway, I don't think that we're trying to make a decision on that at this moment, but that is one of the topics that we did discuss. Ms.
I have a question. Based on the fact it's being shared in your report, what's the disposition of your committee?
Well, we were going to table it to look into it in more detail because I was surprised. I wasn't here. I wasn't a member of the board at the time. Some of these discussions were held in the past. And so I had to familiarize myself with some of the minutes and the votes that were made so that I can really give some input to the board about what I saw and help to direct them if they wanted to look at it for themselves. They had questions about votes in the past.
Thank you.
Did I answer? You still have a puzzled look?
I'm just trying to ascertain the position of the current committee. In other words, as a committee, you're doing a certain amount of work and you bring recommendations to us as a board. As I listen, I'm unclear if the current committee accepts that or would like to engage in further dialogue or just wants more information or evidence or something else.
Okay. Well, I mean, my position is I always like for the board to engage in dialogue on issues and give them a chance to voice their opinions and thoughts. But we did table it so that the committee would have the opportunity to review the summary of board meetings and agenda items that were presented, and that's where we left it. So because we left it, the committee itself did not reach a conclusion at the time of our committee meeting on September the 28th.
Madam Chair, if I may inquire about the nature of the motion that passed previously. Was it to approve delegation, or was it to authorize seeking legislation to allow for delegation?
Well, there was definitely authorization to seek legislation. Yes, I did see that.
Thank you.
Yep.
The intent, if I may, is to comport with the desire that was expressed in the monitor's report. That was one piece. Legislation earlier this year, before it was gutted and amended, SB 1480 would have done exactly that. It would have delegated authority to the EO to sign off on default decisions, which is a ministerial act. Is that correct, Council?
1480 did require, excuse me, I stand correct, AB 888 contained a provision that required delegation of default authority to the executive officer. That was removed. Defaults involve both the entry of the default and the decision entering a default and imposing the discipline. As it stands now, it's the view of the Legal Affairs Division and a longstanding view that the imposition of a penalty based on a default is not itself a ministerial act. The entry of the default itself is a ministerial act, but without a specific statutory delegation, a board cannot delegate the authority to enter the default decision itself because it involves evaluating whether the penalty is appropriate or not, among other things.
So based on that, I heard the last part is that we can only, if the board chooses to go in that direction, we can only seek legislation giving us permission to delegate we can't make a decision on our own to delegate. Is that right?
That's correct. And the way that is done can be either as what was in SB 888, which was a mandatory delegation, or it can be the discretion whether to delegate or not could be given to the board, and then the board can decide whether to delegate that authority. But at this point, it doesn't have the authority to delegate. So the prior language did say that the board shall delegate, making it mandatory. There was some discussion at the committee level about changing the word shall to the word may, thereby vesting the board itself with the discretion of whether they wanted to delegate that authority once the bill passed.
Yes. Thank you for pointing that out. There was a discussion about possibly changing the language so that it says that the board may allow. But again, as you heard, we would have to seek the legislation for the final determination of it. So, yeah.
So did you table it, or do we need further discussion, or?
Well, we were going to present the language about
The permissive.
the permissive. Yeah, the permissive. And then in the interim, the past votes came up. You want to proceed with the permissive language?
I misspoke a moment ago. Contained in the provisions of SB 1480 was a provision allowing the BRN to delegate the authority to the EO.
Yes.
As part of the omnibus package.
As I'm listening, I just want to make sure we're hearing correctly. It only said BRN, or did it say and?
It was only BRN.
Thank you.
However, I would mention, and in concept, I support the idea as a administrative and labor-saving device. It does comport with the desire of, it's one of the monitor's findings that in order to streamline our operations, we should do that.
And so my comment to that is that there were times when we did disagree with the monitor's recommendations, so that doesn't necessarily dictate our position, but it does help us to streamline our work that we do for the board. But it is a part of our responsibility to oversee and make sure due process is given, whether there's a default or not. So anyway, we can do a couple of things with that. We can table it for the next meeting so that we can provide more detail on past voting, or give the board an opportunity to think about its position, or we can pursue the permissive language in which the board may, if we want to go down that road. Delegate.
I think a similar question to what Madam Vice President mentioned. I know that the Reg Committee has done a lot of work on this and has investigated it. What would be your recommendation that we do? Do you have a recommendation? I believe you said maybe you don't have a recommendation.
Well, again, we left off at the meeting saying that we were going to table coming back as to whether we have already voted on it. Because if we've already voted on it and we're bound by it, then there may not be anything to vote on.
Oh.
So that was the one thing. But we also were prepared to present the permissive language to the board for vote.
So Ken, what happens in that?
But if we've already voted, then that won't matter either.
Well, since the actual we're talking about votes that were taken, or a motion that passed during a prior legislative cycle and action wasn't taken. Since there is proposed language that's part of the report, a motion can be made to authorize the
Giving permission.
to give permission to seek a sponsor to carry the bill that would implement the proposed language that's in the committee report. I think that's found at Exhibit G.
So I'd like to hear from the board as to how they feel about delegating their default decision power. Does anyone have any comments? I think Mr. Deere can respond it.
Any other discussion?
No one has any thoughts or?
I mean, there is precedent for this at other boards. Other boards do this. I hear also what Ms. Turner's saying about us evaluating whether a default should be imposed. I've actually once or twice voted against the default when it comes to us. I mean, very, very rare. And I'm sure probably in the minority on that. But I understand also your point of view, and I also do see precedent and see the need that it would streamline things, and that it is done and it is something that may be appropriate. So I can see both sides kind of the issue. That's my comment.
Then we took a look at the number of defaults presented to us for our review, and over the past 3 years, we've moved to adopt every single one of them.
Yeah. So, I mean, I agree with Samantha. I also agree that it will be some time savings. But what does the ledge committee recommend?
Well, we recommended the permissive language. So that's just saying that we may delegate.
Okay.
It doesn't say we shall or we will. It just gives us the power to do so.
It seems like a good middle ground. I mean, it seems like something that gives us the ability, but doesn't make us do it, doesn't force us to do it.
Right. So if we were to vote on this, it's not a final decision on whether we actually delegate or not. It just says we can or cannot. We just have the power to do so.
So it would be giving the ledge committee the power or the authority to seek an author for the permissive language?
Well, that's a separate vote. Because that's, yeah, we're saying that the board may delegate its default authority to the executive officer. So that's one vote. Then another vote would be to seek legislation if we choose that we want to actually delegate the authority. To seek legislation to get permission from the legislature. You see it differently?
That what Mr. Swenson was saying a bit ago is that to delegate or to choose to delegate does require statutory authority. So moving forward in either path would require the board to seek legislation.
Yes.
Madam President? Just evaluating our brief dialogue here, frankly, it doesn't seem like we are really ready completely to make a well-rounded decision. I would like to ask the committee, which it appears there might be a split in the way this is viewed, and that happens. We're all human, and we all have different views of point, and that's why we're here. But if you would prepare for our next meeting a fact sheet that makes sure we understand all of the options. Very short, very direct, clear, and the implications if we take an action. With the understanding that at our February meeting, we will have to take some action.
Does that require a motion? Or would that be the motion?
And I'm trying not to put it in a motion because I don't think necessarily we want to get into the position of directing committees to do X, Y, or Z.
I don't think that does not require a motion, and I think the way it came before the board is the issue was tabled, and so it can go back to the committee.
Thank you.
And just to be clear, Madam Vice President, the committee would prepare a fact sheet outlining our duties and responsibilities under current law, look at existing statutes and regulations, and coming up with a range of language that we could implement, or at least present to the board for future discussion?
That's somewhat, but I was looking for even greater simplicity.
Okay.
And it sounds like through this brief this lengthy dialogue, there are several options. We could do 1, we could do 2, we could do 3. That's just a numerical order. And on your brief fact sheet, if you will list that, if you do step 1, this is what needs to happen. If you do step 2, this needs to happen. And if there's a 3 or a 4, we just need to know. It needs to be brief. It needs to be simple. You know, I have trouble thinking sometimes. You want to make sure I don't get foggy or cloudy. So with simplicity, I believe we'll be able to we should make a decision in February. Thank you.
Thank you.
And just if I may inquire of counsel, the default is a two-step process. The first would be to verify whether the elements give rise to a default, and the second would be to enter the default. Is that correct?
That's correct.
And
so there'd be an examination, for instance, whether the due process requirements of notice and opportunity to be heard were complied with. You'd examine whether the notice that was given to the licensee was sufficient to warrant entry of the default. And then at that point, the entry itself of the decision would follow. And that's the area where there is some discretion, because the board is allowed to enter the default.
Which is a ministerial act, correct?
Well, enter the
counsel?
default and impose the discipline prayed for in the accusation. The board could modify it, or the board could actually send the matter to hearing even when there is a default. So those are the options under existing statutes. However, rarely does that occur. Anything other than entering the penalty sought in the accusation itself occur.
So the examination portion is non-ministerial because it requires some discretion, or at least application of the law so as to ensure due process for the licensee?
Yes.
And then the second part, entering the default, is ministerial?
Yes.
But then the third part is deciding if you agree with the discipline that's proposed or not, or you want to change and impose some other discipline other than that's was recommended.
Well, my understanding is in the presence of a default, or correctly, in the presence of a non-response by the licensee, what is prayed for in the accusation or statement of issues is the issue. Is that correct?
Yes, and under existing law, the material factual allegations in the accusation are presumed to be true. So therefore, under the Administrative Procedures Act, a decision could be entered without a hearing.
So just to take that one step further, we don't have any discretion as to the penalty to be imposed. Is that correct?
Under the statute, the board actually does have discretion on what penalty to be imposed, because under existing law, when there's a default, the board can either impose the penalty prayed for, impose a different penalty, or actually, in an unusual case, refer to hearing even though there was a default.
All right, thank you.
All right. So, you heard your request, and we'll provide something next meeting. All right, and so that concluded our committee meeting. Our next committee meeting is scheduled for January 11th, 2019.
Cheryl, can I
Yes.
ask about the school fees?
Okay, so, yeah, I guess we didn't include it as a group. All right, so the school fees. Thank you. So, we needed to vote on whether or not to pursue regulations and to pursue the legislation to impose fees on the schools for the use of our NEC services and their application fees. And so,
I have a question real quickly. We voted to pursue this last year. In the last legislative session, we've already approved that. Do we need to reapprove it for the new legislative session, or would it just roll over?
it should roll over, so then the regulations, but, oh, well, okay, we did approve it, we don't have it, so we just need to encourage, our committee as well as our designees who work with the legislature to continue to seek legislation authorizing it. Right? And we also need to work on the regulations. Ms. Yamaguchi, do you have something to say? Because I can see your
If you don't mind.
frown.
Ms. James Perez, you're absolutely right, and in the April meeting that was teleconferenced, the board did approve both sides of what we would hope to run this year. But as the board knows, the legislature themselves and the Senator Hill's office asked us not to pursue the school fees this past year. So technically, a cold read would say that, yes, we did still have the authorization to pursue that second half, but we felt that it would be more transparent to ask the board again to authorize the committee and of course, the staff to continue the process to develop draft legislation and to start shopping for an author to carry the bill in the 2019 session.
So I see the proposed language. I see it in attachment F.
Yes.
Attachment F. I see that it's there in the language. So what we need to do today is to move to adopt the language, and then who will search for the author? Whose responsibility is that?
I believe that would be myself.
And then it would get hopefully adopted by a legislator, and then it would work its way through both houses, same as last year, right? And then we'd get our.
There are a number of different options here. One, of course, my preferred option, my strongest recommendation would be that we would pursue independent legislation. We would find an author to carry this bill separately of anything else pertaining to DCA or anything else. Secondarily, the committee staff had said, because they were actually quite appreciative of the fact that we were very cooperative and collegial and have done a considerable amount of stakeholder outreach, which is in no way done. We could probably still work through either the committee, and of course, there's also still the possibility of being included in DCA omnibus bill language. So there are all these possibilities, but my preference would be to pursue a separate bill that we would run ourselves.
I would strongly agree with you, because in the past, even this last legislative session, but in years past, we have been, I don't want to say burned, I don't want to make it sound like that, but we've not had the, things haven't gone our way when
We
we've
haven't
been part of
mastered our own destiny, yes.
of a bigger bill. So that tends to work out not in our favor sometimes. So I would be of the same opinion of you that we should seek independent legislation.
And just as a footnote, strategically speaking then, what I would recommend happening then is, of course, as we go forward with this draft language, if you choose to approve it today, I would start contacting some members, but we would be, of course, working through both the executives and the Leg committee on how things develop, when there are decision points, for example.
All right, so you would like a new motion to pursue legislation.
But at the committee approved the following motion: to recommend to the full board to accept staff's recommendation of item 5A, which was the school fees, and to authorize the board staff to seek an author. So that comes before the board with a, having been moved and seconded.
Yes, all right, so we voted on it before, but we're going to vote on it again.
So we vote.
All right? Yes.
So is there further discussion by board members? Seeing none, any public comment? Seeing none, we'll do a roll call vote. Paul?
No.
John?
Yes.
Paula?
Yes.
Bernice?
Yes.
Myself is yes. Ken?
Yes.
Samantha?
Yes.
Alita?
Yes.
Cheryl? Motion carries. Thank you. And Cheryl?
All right, so I think that covers all of the action items in our report at this time. So it's the end of the report.
Thank you. And we will move on to the Enforcement Committee meeting, or committee. Sorry, Samantha.
It's okay. Okay, so what you have in front of you is an Enforcement Committee report and an Enforcement Division report. I'll quickly go over the Enforcement Committee report. We met on September 26, 2018, and for the most part, the Enforcement Committee continues with its work. We are making progress in all areas. I'm going to give you some highlights. One of our highlights is that we have a new enforcement chief who's in front of us here, Candace Rainey, and we're very excited to have her. We've made some other hires that I believe are in the audience as well, such as our statistical analyst, Pooja, who's here with Matt McLean in the audience, and we're very glad to have her as well. Candace talked a little bit about what her priorities are and what her vision is for the Enforcement Division. We have some updates with the special investigators. They've been going to have some renewed training, including the National Certified Investigator training. And they have been going out also in teams or more than one, and just enhancing their activities and their protocols. Probation unit, our number of probationers continues to increase. We're well aware of it. We're tracking it, and the probation unit is handling those. But we are, as time goes on, getting more probationers. We're up to 425. And there's 54 cases also at the AG's office waiting. Board enforcement statistics, there's a very colorful and detailed statistics report that Ms. Rainey's going to go over in her report. The last two things I wanted to talk about is I discussed last time there's a DOJ fingerprinting issue that has to do with DCA and DOJ. It is not something caused by any fault of ours. I want to make that clear again. But if you remember, some of our licensees that had been previously fingerprinted, we were not getting status updates or updates on their maybe criminal convictions or hits on their background, that sort of thing. So we're going to have a large number of current licensees that need to be re-fingerprinted The number at last count was about 3,000. And I see Vicki shaking her head that's about right. Again, this was not something that was of any fault of ours, but it is something that we need to handle and take care of, especially in the public interest. This also affects all DCA boards, correct? Or at least most of them. Yeah, there's not just our board. There's other boards that are affected. We are continuing to develop a plan to roll this out. We don't have specific details currently. One thing we discussed, and we're all on the same page, is it's very unfortunate. We want to mitigate the the burden put on our licensees for re-fingerprinting, because there is a cost associated with it. And this was not an error they made, but they may have to pay to be re-fingerprinted. So Vicki was looking into creative ways that we might reduce that amount, and that's ongoing. So we do have our licensees in mind, and this is a developing situation. I know Exec is also following this fingerprinting situation. So more to come. The last thing I wanted to talk about is that we are going to be revising the disciplinary guidelines. Especially now we have our enforcement chief, and we have some staff assigned, especially from the probation unit, including Rocio, working on the guidelines and changes we might like to see. And we will be discussing this again in the future, coming up with some specifics to bring back to the board. So basically our enforcement committee, many things work in progress, many things we are monitoring. We also, of course, continue to implement the monitor's recommendations, and our next report due to the legislature is January 1st, I believe. And you've seen those reports. We continue to report back and keep an open communication. We continue to implement. We've implemented already the vast majority of them. There's a couple outliers, especially when it's the implementation of certain recommendations are not dependent solely on us. There's other agencies or other entities that we have to work in collaboration with. But overall, significant progress on all fronts. And you have the report in front of you for additional details.
Any comments or questions for the committee?
Yeah, I will ask one question. I'd heard some discussion about, and I just happened to see it here, talking about reviewing the guidelines for minimum and maximums. Is it possible to review whether or not there could be a status of a revocation without the possibility of having the license?
Interesting. Yes, in other states, there is actually, other states have a disciplinary action that is permanent revocation, for lack of a better word, or lack of a better phrase. They word it differently in different states. But in California, we can revoke a license, but of course, you can come back as many times you want for reinstatement. But that's not the case in all states. And there are some cases that this board has even discussed that have said, is this something that could ever be, they would ever maybe be a nurse or a psych tech again. There are some just grossly negligent criminal, certain acts, horrific acts that happen. And I think that's something we should definitely look into. I agree with you. That may have to do with some law change, some statutory change, I'm not sure. But I think it's something we could definitely look into.
Just assuming they were reviewing the guidelines and the mins and max, if you could look at that, that would be great.
Absolutely, and we can get some benchmarks for that and see what other boards do, if maybe even within our own system. I think it would be the right time, if we're going to do that, it would be the right time while we're reviewing the guidelines.
Samantha, another thing that while you're reviewing it, you may want to review some grossly negligent act to have an immediate suspension, possibly, in there?
Yes, we do have the ability to suspend and immediately suspend for certain acts, including, there's a PC 100, which is for certain sex crimes, I believe. if I have the code correct, that we do immediately suspend for. But I know that it's not used that frequently, and it may be restricted to a specific type of case. And yes, I think we could all agree that there are definitely some instances in which the protection of the public would demand an immediate cease of practice. So I think that could be expanded.
But while you're reviewing, that might be something good to review also.
Absolutely.
Any other comments or questions? Seeing none. Thank you, Samantha.
Thank you.
And we'll move on to the Enforcement Division report. Ms. Candace.
Thank you. What you have in front of you is my Enforcement Division report. Unfortunately, it starts out by saying, attached is the overview of enforcement activity report, which actually was not the case. But I have provided that, and that is the colorful chart that Ms. James Perez alluded to earlier. Out of respect for the fact that you all have had a very long 3 days, I will make this brief. In my report, there are notable highlights, and so what I intend to do is give you highlights of my highlights. And if you have any questions, I would be happy to try to answer those, and if I cannot, I have brought back up in the Matt McLean and Pooja Mohan, our resident experts with regard to statistics. So overall, the statistics continue to bear out that the process improvements that have been put into place are, we're realizing significant progress from those. And so just as an example of some of those, you know, at a base level, of course, everything starts at our complaint intake, and that number continues to kind of hold steady. In looking at the last 5 quarters, we have had a range of about 213 received to 242 received. So that continues to be steady. With regard to investigations, we have seen an increase in the total number of investigations that were assigned for investigation. There was an increase in the total pending number of investigation cases. There was a decrease in the average days of the pending age of each of those investigation cases. There were a total of 567 investigations completed during Q1 of this past fiscal. With 567 cases completed, the average days to complete those cases fell to 248 days, which is still well below our target average according to the performance measures of 360 days. So we're doing very well in that respect. In the area of formal discipline, there were 82 cases that were referred to the Attorney General's office. And at this point in time, I think our most recent statistic said that we are at an average of 839 days to complete those cases. Our target average is 540 days. I've said before that is somewhat unrealistic, and I know that the department is looking at that. But I wanted to give you some information that maybe puts it in a little better perspective, and that is Jay Prouty and his group. In the last quarter, actually in the last 3 months, roughly mid-August to mid-November, of the 25 oldest cases pending, 21 of them were closed. So I think that that speaks a little better to the measure of progress that we're making as opposed to that average of 839 days. Are there any questions with regard to the statistics before I move on? No? Okay, now for the fun stuff. Staffing. The Enforcement Division currently has 1 vacancy, and that is for the position of Staff Services Manager 1 over the Licensing and Applicant Screening Unit, which is formerly the Complaints Unit. The final filing date for that was November 6th. I have received, reviewed, and rated all of those applications, and I'm happy to say that the candidate pool looks very promising. I think one vacancy in enforcement that has a total of 38 people or positions is, that's pretty incredible. So we're looking forward to getting that filled, and knock on wood that we will be fully staffed. We did have a couple of new analysts that joined us during October. You met Pooja earlier. She's been a wonderful addition to our team. We also added Hong Nguyen, and she is the board's newest probation monitor, and she is catching on quickly, fitting right in, and also bringing a great deal of value to the program with her past experience and resources. In compliance with Business and Professions Code Section 2847.8, we continue to meet with the Division of Investigation to review and discuss the board's pending caseload. And that next meeting needs to happen on or before December 1st, and it is currently tentatively scheduled for November 26th. So we're right on track with that. As for the monitor's recommendations, we continue to make improvements in that area. I have been working with all of the enforcement program monitors and managers to review the current report and kind of provide me with input as to what has been done and where we are and where we're going. And so after having a chance to review that, I will be working closely with Vicki and Elaine to prepare the draft report for the legislature. Just to give you an idea kind of what the past 90 days have looked like since I've officially been here 3 months now. I have had the honor of conducting one-on-one interviews with many of the enforcement staff, which was really a great experience, getting to know them a little bit better, getting to know kind of what they do for the board or what their personal goals are. I've established biweekly enforcement management meetings where I meet with each of the enforcement managers as a group. We sit down, talk about kind of everything that's going on in their respective units, and as well as disseminate information that's valuable to the group. I've looked at each of the programs to ID the processes, procedures, their resource needs, and training, and that includes staff development needs, because it's important to me that we're always working to develop our staff and prepare them for the next level. We have taken steps to increase communication and coordination between the units, and that's going very, very well. It's been very well received. The staff is excited about that. They're very engaged. And I believe very strongly that that will strengthen our overall work product. I also had the opportunity and the pleasure of joining the special investigation team on one of their investigations for the purpose of observation. And that was really eye-opening. I am trying to inform myself of all of the various areas of the board, some of them that I've worked with in the past and some I haven't, special investigations being one that I have not. So I'm enjoying getting to know that. I also had the pleasure to meet with Jessica Gomez, our nursing education coordinator or consultant, regarding all things related to our education division, which is also new for me. I enjoyed that. She was very, very informative, and just really a delight to sit and talk with. For the future, what I'd like to do is I'd like to establish weekly reports where the enforcement managers from each of the units would provide information on a weekly basis regarding their workload and their statistics. And that would ensure that we're all on the same page in the way of moving the programs forward, addressing any current backlogs, as well as avoiding any future backlogs. I think that will also put us in a good position because, as we've discussed, there are a number of legislative changes and new laws that are coming in that will likely have a significant impact on enforcement. So we want to be ready to meet those challenges. I have scheduled to meet with the Deputy Attorney General Liaison on November 27th. Jay Prouty is going to join me, and we're going to drive down there and have a chat with him. I have a list a mile long of all kinds of questions and concerns and requests for guidance from him. So I'm looking forward to that. I want to work with each of the teams to set quarterly goals and then help them develop a plan for attaining those goals. We have a lot coming up. We have reports to the legislature. We have sunset in the not too distant future. And especially close when you're coming from an enforcement perspective. So I think setting quarterly goals and planning ways to meet those goals will be important in that respect. Another thing I'd like to do is work with other agencies in coordinating efforts with respect to those individuals who may be cross-licensed. I think that that's really important. I think that it's a good thing for consumer protection first and foremost, but it's also good for the board because it streamlines our processes. It helps in the way of fiscal accountability, and I'm looking forward to that. One of the things that you mentioned in a couple of the major projects that we have going on in enforcement and specifically probation are the disciplinary guidelines. So at this point, what we've done is we've established a work group that's responsible for reviewing the current disciplinary guidelines. We're going line by line, term by term, identifying what are the challenges that we face in implementing and monitoring our probations with the current terms as they are, but also what would we like to see. And in part of that research is looking at other boards and what are they doing, what are they using, what's working well for them, what's not working well for them. So that is a huge task, but it's definitely one well worth the investment. And I have made notes here to take a look at the possibility of implementing a permanent revocation status or an option for that. So we'll bring that back and include that in there, as well as maybe some of the rationale that other boards have or other states have for using that term, as well as the grossly negligent acts and the possibility of implementing an immediate suspension for that. And last but not least, we are looking at our cost recovery program, a review of that entire program, and an audit to kind of figure out where are we and where do we need to be and develop a plan for getting there. That is all I have. If you have any questions, I'm happy to answer those.
Just a brief question on the issue of cost recovery. Have we ever employed a tax intercept program?
We do.
Okay, thank you.
Any other questions from board members? Seeing none. Thank you, Candace.
Thank you.
So that brings us to agenda item 22, public comment on items not on the agenda. Public comment, individuals may appear before the board at this time just to discuss items not on the agenda. The board may not discuss or take any actions on any item raised during this public comment section, except to decide whether to place on the agenda of a future meeting. Any public who have comments? Seeing none, we'll move on to agenda item 23, suggestions for future agenda items. Individuals may request future agenda items at this time. The board may not discuss or take action on any matter except to decide whether to place the matter on the agenda for future meetings. The only one that I can think of is the one that Paula was asking about in regards to the community college, possibly. Is that appropriate to have the NECs present how the community colleges possibly do or their process to admit?
Yes, that would be appropriate for a presentation if it was properly agendized.
Okay.
Huh? Education committee or?
We could put it to Education Committee and have them present at the next board meeting?
We will take it under advisement. Thank you, Madam President.
Any other items?
No, we just, I just wanted to mention something. We had a very interesting election, both state and federal. And I just wanted to say congratulations in the interest of mentioning that we have a new, newly elected assembly person from the 40th District, member of the San Bernardino County Board of Supervisors and former chair of the San Manuel Band of Mission Indians, first Native American elected to the legislature as far as I know. James Ramos.
We also have the first Korean federal senator elected by, I think it is 39 in Southern California. Young Kim is our first female Korean senator, federal senator. So congratulations. State senator, I'm sorry.
Any other comments? I would like to thank the board staff for working very hard in making the board meeting happen and getting us the appropriate items that we need to do the meeting. Thank you. With that being said, we're to the last agenda item. This meeting is adjourned. Thank you.